We are live. Yes, we are live. So if you can hear me loud and clear, please put it in the comment section and write loud and clear. If you can hear me loud and clear, put it in the comment section. We are live. I want to welcome everybody. This is Sickle Cell Parenting Conference 2024. Sickle Cell Parenting Conference 2024. 2022, we did the first maiden edition. That's the first one in Africa. And it was so beautiful. This year, we are doing another one. Last year, we were not able to do it because of circumstances. But thank God we are able to do the 2.0. So if you are here and you can hear me, kindly write loud and clear in the comment section. Write loud and clear in the comment section. So I am Kemi Oguntime. For people who don't know me, I am Kemi Oguntime and I'm a sickle cell warrior. I'm a genetic counselor, I'm a sickle cell specialist, and a public health. And at the same time, I am very passionate about parenting a child with sickle cell. My story started with living with sickle cell, with my parents not knowing what to do. My parents were clueless, we kept looking for various solutions, and that thing actually affected my life differently. When people believe that they keep telling you do this, do that, do this, it was a lot of confusion. It was a lot of confusion, and that thing made my health to be worst. So it means that we are spending money, we are doing everything we are supposed to do, but at the same time we are not getting results, until I decided to start asking myself, what exactly is sickle cell? How exactly do I manage sickle cell? And then I started learning about sickle cell when I was 18, and that was the year 2009. And since then I haven't looked back, and I've supported a lot of people. I'm also the founder of Ignite Sickle Cell Initiative, a not-for-profit organization that has collected so many awards both home and abroad. So the work we do is because we are passionate about it. I want to welcome everybody: Adeyanju, Adebola, Yasmin, Uma, Kitri Park, Rufai, Farid, wherever you are. I welcome everybody. I understand the pain for you to have a child with sickle cell. And this is the reason why we are creating a community. This is not just a conference. This is not just a conference that everybody just wants to do this conference and then we are going. No, this is more than that. This is building a community. So I welcome everybody. If you are here to join us, you are missing out. We are live. We are live. We are live. So we have bringing so many experts. We are bringing in so many experts, and the goal is for them to talk about various aspects of parenting a child with sickle cell. So we are going to talk about the physical, we are going to talk about the emotional, we are going to talk about identity, we are going to talk about building trust. Everything we are going to discuss about it. So this is a conference that you are not going to forget about. So today, I want to speak to every person that has a child with sickle cell. I want to speak with us, and I understand. So I want to speak to every parent that I hear, every parent who has a child with sickle cell. Parent, I want to speak to you heart to heart. When you look around, for everybody that are present in this conference, they have a child with sickle cell. Every single person here understand a journey that most people cannot comprehend. You are not just parents, you are warriors, you are advocates, you are medical experts, and the most profound source of love and strength to your child than you will ever know. So today I want you to come into this conference and understand that we are just not creating a conference just to have becoming um, oh, I'm so sorry. I'm so sorry about what is happening. So please, sorry. I think something happened to our network. We are so sorry. So we have walked into your we have walked into this journey, so we understand there is countless lights of in hospital rooms. You have to become an expert, even though when you don't have anything to do with medicine. You must learn how to read and understand your body, the body of your child, when nobody understand it. You are fighting countless battles in the emergency room with almost everybody. And at the same time, you are also dealing with a lot of guilt. You are dealing with guilt, you are dealing with fear, you are dealing with so much emotion. A lot of parents have also neglected themselves because you have a child with sickle cell. There is a pain of somebody living with sickle cell, and there is a pain of people who has a child with sickle cell. So we understand all this, and this is the reason why we are creating this conference. This conference is your space. This is where we acknowledge that parenting a child with sickle cell is not just about managing the child physical health alone. It involves a lot of extraordinary act of love and resilience. So what do we promise you today and tomorrow? In the next 2 days, we promise you that we are going to provide you with information on how to manage your child physical health. We want to talk about pain, we want to talk about crisis. We also want to offer practical strategy that work for daily management. At the same time, we are also creating a community where you will be understood, where you'll be supported, and where you will be understood. And at the same time, we also want to tell you that every child living with sickle cell, they are unique. They have potential that is unlimited. So every child with sickle cell, they are not defined by that disorder. We want you to understand that It is simply one part of them that live with sickle cell. They, beyond that sickle cell, is amazing humans who have a lot of potential. And when it comes to raising a child with sickle cell, we want you to be able to understand that even though they live with sickle cell, they are not their sickle cell. So beyond their sickle cell, they have potentials, they have dream, they have purpose, and it is the work of us parents to be able to learn how to combine everything together and ensure that we are bringing out a refined gold out of every child. And we are not just talking about the children alone, we are also focusing about you. We want to talk to you about self-care. We want to talk to you about how to help your child and at the same time help yourself. So this is not just about giving you an extra body, but about lifting burden from you. To every parent here, your exhaustion is valid, your fears are understood, your love is powerful, and your resilience is something we all look forward to. So this conference is a statement to your strength. We are here you and remind you that you are doing an incredible job. So welcome to Sickle Cell Parenting Conference 2024, and I remain your convener, Kemi Oguntimehin. So we are waiting for we are starting right now. We are bringing in the first speaker, and the first speaker is the person of Dr. Shuku James. Dr. Shuku James is a resident doctor presently at the University Teaching Hospital, Benin. Dr. Shuku as somebody that have worked together on managing a lot of children with sickle cell. And it was actually because of the passion of what we have done together that allowed Dr. Shuku to be able to go into residency or in orthopedics. Why? Because a lot of patients living with sickle cell deals with AVN and every other thing. And this AVN is a complications of sickle cell. And Dr. Shuku is presently a consultant in that in orthopedics in a way that he can support people living with sickle cell, people living with sickle cell when it comes to AVN, osteomyelitis, and every other aspect of sickle cell. So Dr. Shuku understand what it means to manage somebody with sickle cell. I'm not just bringing somebody who doesn't really understand what sickle cell. So Shuku has been somebody that have managed me for a lot of years, and it is somebody that is still doing well. So can I see if you can hear me now? Please, welcome to Dr. Shuku. Dr. Shuku is here. Welcome to Dr. Shuku. Please let us welcome Dr. Shuku into our midst. Dr. Shuku is going to be our first speaker. He's yet to join.
You can ever send that video to the person.
Okay, I think we have Dr. Shuku here. I didn't see him.
I'm sure you not switch to the system.
No, he's not here. He's not online.
Do you want to call his number? I can call you on this one.
Call his number. Please help me to call his number. It's 090
Hold on, please. 290
33
30
70
70
91
91
46.
46. User busy. Yes, you're very ready. Thank you. It's the way this doctor is acting clueless money. You just that way.
I'm so sorry. I don't know. I think there's a little bit of delay from the doctor, but we are trying to bring him on board as soon as possible. Mm-mm.
Back to play on the phone. Where's doing back?
So while we wait for him, I'm going to talk to us about the reason why we must understand parenting with a child with sickle cell. Have you ever noticed that when you have a child with sickle cell, especially when the children are in adolescent age, when they talk about mommy, you don't understand me, or when you talk to them, you want them to like proactive, you want them to be able to take charge of their health, you want them to be able to do so many things on their own. But it sometimes it looks like they are not, they don't even care about their health, or you think that there's something they are supposed to do. This child is not supposed to do this. That is exactly what they are doing, and you're wondering what is wrong with you, why are you doing all this, why are you doing all that. And this thing can be very very frustrating, especially when you're doing all your best towards ensuring that they don't end up in crisis. One of the things that we often neglect when it comes to this issue like this is emotional connection. We are forgotten, our parents, we often focus on children with sickle cell. We only focus on their health alone. We are only seeing that sickle cell. We are only focusing on just don't have crisis, just don't fall sick, just don't get tired. I just want you to be able to do well. I just want you to be able to do this. We neglect other aspects of their lives. So these children, despite the fact they live in sickle cell, they also want to live as normal as possible. Some of them want to become a medical doctor. Yes, I have a lot of sickle cell warriors that are medical doctors. Some of them want to be pilots. Some of them want to be astronauts. Some of them want, they have dreams that you are looking at them like, you that you live in sickle cell, you are the one that have this kind of dream. And in the moment, sometimes we don't know. It's something we do unconsciously, and we keep telling this child, no, you can't do it. No, this is not for you. No, this is not for you. This is not something you should be able to do. And while we are doing that, we are creating an identity that says that you are your sickle cell. That's not intention. That's not never our intention. But this is the kind of intention that we create when we keep telling no, you can't do it. It's not for people like you. This is not something you are supposed to do. This is not something you needed to do. This is not this. This is not that. And before you know it, it's becomes their identity. So they start internalizing that identity. They start seeing themselves lesser than they are supposed to see. it affects their self-esteem, it affects every aspect of their life. And it's even because of this that we tend to have a lot of struggles, especially when they come to adults, when they are adolescents, when they are teenagers, because they are dealing with sickle cell. At the same time, they are trying to talk to people that I am beyond sickle cell, and there's a need to balance this together. It's also one of the reasons why we are having the parenting conference, because we are bringing, there's somebody that is coming tomorrow that is going to talk about sickle cell and identity, how you are able to manage it, to be able to manage your child health, at the same time not create an identity for them. Uh, and and this is a very common thing that we do, especially when we have a child with sickle cell. Please, can you help me to call the person again? We are waiting now. Yes, we already have Dr. Shuku is going to join us in the next 2 minutes. He said there is some kind of emergency and is going to join us in 2 minutes. So I want to say sorry for that delay of time. We respect your time as much as possible. We respect your time, but this is just an emergency that we didn't plan for. So he's going to join us in the next 2 minutes. And please, while I engage with us, so while we are waiting for Dr. Shivu, can we tell us some of the challenges that we have, or what are our expectations about this parenting conference? So I just want to read your comments in the uh, I just want to read your comments, and I will be able to talk about it. What are your expectations? What are those questions that you have when it comes to parenting a child with sickle cell? What are your fears? So we want to know your fears, we want to know your expectations. We also want to know the reason why, what you are expecting from us. So we are, when we talk about that, we use that opportunity to be waiting for Dr. Shuku. He said 2 minutes, and the 2 minutes starts now. Yeah.
Yeah, doctor, we're still waiting for you. Please do. Thank you very
If you
much.
just use the link I sent.
Yeah, just join through the link that was sent to you. All right.
So, okay, I want to learn how to parent better. Yes, this is one of our goals. This is one of the things we are trying to achieve in the conference. We also want to let you know. Okay, how can I want to make an inquiry that how can parents access good health care for sickle cell warriors? Yes, we have one session today, and one of the session is we are talking about access to health care. So I'm bringing it, we have two speakers, one from the NHIS, the National Insurance of Nigeria, and we also have somebody from a private HMOs. So they are going to talk about, because I've worked with these two people, and then I understand a lot of us don't understand how we can access good health care with small money, because sometimes sickle cell takes a lot of money from us. We are not going to lie about it. Sickle cell require a lot of money to manage. So sometimes most of our crisis will come at the time when you might not even have any money. For warriors that we work to, one of the things we also do in my not-for-profit organization is that we liaise with government to be able to place some of our warriors on free health insurance, and we've been able to achieve that presently in Ondo State. We are registering our warriors. So if you are in Ondo State, if you are part of those people that you are watching me and you are in Ondo State and you have not benefited from that program, after this program, please send me a private message. We are going to enroll your child under the free health insurance in Ondo State. But if you are in other states where you don't have access to that, yes, there are other ways you can get involved with health insurance with money that is not too much, and at the same time it will give you a full coverage to manage your child. Yes, so we have people that we are bringing, experts that can talk about finances and how to access good health care without breaking the bank. Yes, ways not to my suggestion is to be more enlightened about the whole management process and ways not to feel more guilty. Yes, one of the things parents that have children with sickle cell, one of the things we deal with is guilt. I've worked with over 200 parents and I understand guilt is a huge emotion. And tomorrow is where we have a clinical psychologist, and he's going to talk to us about guilt, about our emotions, and then talk about personal self-care. So when I told you that this conference is loaded, no, I mean it. I mean it that it is loaded. Yes, medicine ebele shukuma. Most hospital don't give good medication to NHI's program. Yeah, that is why we are not just bringing people from NHI's alone. We are also bringing somebody for private HMOs that I have. For somebody like me, I combine two together. So it means that when you are going to maybe public hospitals, you can make use of your NHIS. It helps you to cover some of your tests and all that. So if you're also dealing with another one, you use the private HMOs. But this is what has worked for me, and this is the reason why we are bringing these people to talk to you and then talks about their plan and how it will. Because the private HMOs, that no matter how I'm sick, once I have done my plan, I have free access throughout the year, throughout the year. So even if I'm going to the hospital 3 times a week, 5 times a week, they treat without collecting anything from me for the private. Oh, there is a caption, sir. What you have to do is to go to, sorry, I'm so sorry, Mr. Yusuf Mohammed. Yes, there's a caption. Please go to your own YouTube as you are watching me. On the top of it, you are going to see a logo that says CC. Click that link, and then it's going to bring out the caption. It's going to transcribe it fully. I am very, very sorry that we are not really transcribing from our end. But you go to that option and then it will be able to transcribe for you. So I'm still waiting for our questions. What exactly what are your expectations? What is it that you want to learn from the sickle cell parenting while we are waiting for our medical doctors to join us? This is not our plan, but as it is now, either it is emergency or network, both is making us join. Mm-hmm. I don't understand. Maybe I should call somebody else. Kíní ẹ̀ ti deliver nsìn, so ó jọ kó ti ní access pé let's know what the okay, I think it's live now. I think it's reading now. Okay. So finally, we have Dr. Shuku in the building. We have Dr. Shuku in the building. Oh, the caption will be available after the video, not when the video is in session. I tried using it. So what is there any software that we can do? Because I don't know. I thought, because mostly I use the caption. Is there something we can do that you can tell us so that we make provision for it, especially for you tomorrow? If it is, maybe, is there any software that we can bring on board to ensure that everybody are fully involved in this? Please.
Like a limit.
I'm not seeing this person.
It's on my phone.
Okay. Yes, so please let us welcome Dr. Shuku James. Ewo, ewo. Yes, we have. Hello. So, Dr. Shuku, can you hear us? We are way behind the schedule. Please, can you open your video so that we can see you? While I leave the stage for you. Dr. Shuku, we can't see your video.
Can you hear me?
Yes, I can hear you.
Okay.
Yes, I can hear you.
Hello?
We can't see your video.
Oh,
We can't see your video, please.
okay.
Yes.
Can you see me now?
Good. We can
Hello?
see you now. Welcome, Dr. Shuku. Hello.
Hello. Good evening.
Good evening.
Audible?
Welcome. It's been a long time.
Yes. I'm happy to be here.
So, our guests are ready for you. They have been waiting for you for the past 15 minutes. So,
Oh,
please,
I'm very sorry.
let's go
I'm
on
very, very
as
sorry.
soon as
Very
possible.
sorry. Okay, I'm very, very sorry. I have a network. I have to change my network. So I don't know what happened, but it's well.
So sorry. Network can be so frustrating sometimes. Oh, I think we lost that connection. Yeah, it's back.
Hello?
Hello, Dr. Shiku, you are back.
Yes.
Yes.
Okay, so let's start. Can we start now?
Yes, let's start immediately.
Okay. Can
We have
audience
been
hear me
waiting
very
for
well?
you.
Okay, okay. All right. And I don't know, can I share my slide? Can there a way the slide will be shared?
Yes, from the back end, you should be able to find
Okay, no
have
wahala.
a way. Yes. So let me give
No,
you the space. Let me
it's not showing
exist.
slide share here. Okay, so can I start?
Yes, you can start, please.
All right. Though I don't know the audience in terms of variety, but let me start by saying good evening, everyone. From this side in Nigeria, uh, is I'm sorry for being behind time. I have serious problem with my network. I have to change the network source, so that was why I was behind time. But in all, we are going to discuss about managing sickle cell disease and what to do when a crisis occurs at home. Am I audible enough? Hello? Am I audible?
Yes, you are audible.
Okay,
Please, if you
thank you.
can hear him, can we hear Dr. Shukwu? If you can hear, please type loud and clear in the comment section so we know that we can all hear Dr. Shukwu.
Yes, better. Okay. So I will go with this outline, introduction, epidemiology, then brief etiopathogenesis, then presentation, management of this condition, both at home, prevention, then we summarize. It's a brief one. I'm going to be fast because I'm already behind time. But I promise you it will be more practical inclined. So we are discussing managing sickle cell disease and what to do when a crisis occurs at home. I believe the house here knows more about sickle cell more than me. I just have that feeling that many people here know more about it, either by personal experience or by research or by thorough reading. So I'm kind of here to just air my own view or the few current updates regarding sickle cell and how we can go about it. As we know, sickle cell disease is an inherited genetic blood disorder, which is characterized by red blood cells that are assume abnormal shape, they become rigid and then become sickle in shape. So all of us know about it. But sickle cell disease is not acquired,
Yes, I'm
but rather, an inherited or
Omo,
hello,
bá mi ṣí
there's a
kíní
noise
yẹn bá.
in the background. So, but rather, it is an inherited genetic condition. Now, like we know, the issue is about abnormal hemoglobin. It's embedded in red blood cells. Now, we know the normal hemoglobin from the fetal life, hemoglobin F, down to the adult hemoglobin. But when these are absent, the other forms to give us sickle cell disease. So one, at least one, it becomes sickle cell disease. But when both of them in form of homozygous, that is an individual that have two abnormal hemoglobin, like hemoglobin F, we refer to it as sickle cell anemia. So all sickle cell anemia are forms of sickle cell disease, but not all sickle cell disease are sickle cell anemia. But the problem in this sickle cell is that there are recurrent episodes of crisis and progressive organ damage. So it's important that we know about it. A brief introduction. Those days in Africa, the people call Obanjes. They used to call them Obanjes, which is very, very, then they cannot explain what is going on. They will give birth and discover that these people tend to complain a lot. They don't have weight, they lose weight, they're always in pain, they are not happy. So they say these people, we can't explain much about them. And they call them Obanje. But thanks to our modern civilization and our advanced knowledge, we're able to know the real information about sickle cell. And I don't like calling people with sickle cell anemia as my patient or patient. They are people, except when they are ill, they become patients. But they are normal people who have uh, abnormal hemoglobin. So in that form, they will feel happy. You want to remember also that the 19th of June is the World Sickle Cell Day, which all of us know. I know most of us know about that. It's very important. Now, a brief epidemiology. Worldwide incidence about approximately 7% of the world population. But I'm more interested in Africa. In Africa, 2% of newborns affected by sickle cell anemia. That is, in every 100 births, two will have sickle cell anemia. And while about 20% to 40% have one form of sickle cell disease. The frequency of sickle cell in Nigeria is up to 30%, but sickle cell anemia is 2 to 3%. So it's the same thing. In every 100 people, about 2 to 3% have this issue. And so it's important to understand and itemize it. The age, the median age of people that die from this condition when they don't do the right thing is about 42 years in male and 48 years in female. So that means females are more careful and they know what they are doing more than the men who live rough life, who go ahead exposing themselves to the risk factors and they don't take care of themselves. So it is a condition that we need to be careful. Sickle cell gene is commonest in malaria endemic areas. And that is why here in Nigeria, which is West Africa, we found it to be prevalent and quite common because of what? Malaria. Now, the problem is that I just want to go a bit scientific, just a bit scientific. The problem is that there is a gene. This gene is autosomal. It is not a sex gene. It's rather an autosomal gene that leads to this condition that we
And
call
we are
sickle cell
speaking.
disease. This gene is located in hemoglobin. And the problem is that there is a change in amino acids, glutamic acid to valine in position 6 along the chromosome 11. So people that have this problem within the beta chain of hemoglobin, they tend to have this condition. Once again, sickle cell disease is an inherited condition and not acquired. And
Let's talk in
various
half.
form of sickle cell disease and various form of sickle cell disease include hemoglobin SC, hemoglobin SD, hemoglobin SD, and other forms that can cause crisis anytime there is sickling. Now, the idea about thalassemias are also incorporated when we are talking about sickle cell disease. Sickle cell traits, hemoglobin SA, sickle cell anemia, hemoglobin SS, which I told us is the homozygous form. And then other variants of it are all classified under sickle cell disease. Now, how does one inherit it? We have agreed that it is an the problem is from inheritance. Not when you go and not when somebody eats something or when something bites you or when somebody gives you blood. No, it
Let's
is
talk.
from inheritance. So the inheritance here is that two couples who are getting married to each other have a big role to play. They have a big role to play in terms of transmitting this condition to the next generation. So when two people who have abnormal forms of this hemoglobin get entangled and give birth, they can transmit it to their progeny. So, and that is why it is important when we are managing patients with this to realize that it is what an inheritable condition. So, So we must be aware. For example, an individual who is AA and get married to someone who is AS will end up having a child, possibly a child, but none of them will have. If someone who is AS get married to an AS, there is 25% chance that the child could have sickle cell anemia at each birth. At each birth. So we want to be aware of this. Again, for someone who has that hemoglobin SS getting married to hemoglobin AA, there is zero chance of having a child with what? Hemoglobin SS. But all the children we have the traits, the traits of this condition. So, and that is why when we are counseling, we say that people that have SS should never get close to someone that has either AS or SS. They should rather look for AA, just to avoid bringing forth to birth of persons who have this abnormal gene. The problem in sickling is that if the condition becomes favorable for the sickling to occur, what will happen is that the red blood cell change, which the shape will change, the one we call sickling. The membrane will be altered, the cells will dry up, and it will bind and get stocked up. And before you know it, the crisis will start. Children who are born, who are in the womb, they rarely have this problem because they have hemoglobin F or the fetal hemoglobin, which helps them to adapt and to nourish well. But as they get to 6 months and above, the fetal hemoglobin will be replaced with adult hemoglobin, and therefore they start having the episode of crisis. Now, crisis comes in various forms. It can be in form of vaso-occlusive crisis. It can be in form of acute anemic crisis. It can also be in the form of infectious crisis. Now, vaso-occlusive crisis is usually the commonest form. But before we go there, in children, what the first thing normally happens is that they tend to have painful and swollen wrists and ankle or foot, the one we call hand-foot syndrome or dactylitis. So they will have it and they will complain. That's the first sign that there is a problem somewhere. So this crisis is because blood is not getting to the point where it's supposed to get because of what? The sickle wave that is impending and blocking the free flow of blood and thus causing problems in the body. So thereby creating different forms like dehydration, low oxygen tension, acidosis,
Okay.
excessive exercise. When you sweat so much, if you sweat so much, you lose water. It leads you to dehydration and encourage what? Crisis. Physical or psychological stress. Yes, we have to say that people who are sickle cell, they should work. But at the same time, they should know their limit to stress because stress triggers crisis. Pregnancy is also a precipitating factor. Exchange of weather, particularly cold temperatures. When the weather is so cold, it can teach you the crisis. Alcohol is noted to also to cause crisis. Excitement, when you want to celebrate birthday or marriage or you want something good, somebody bought a car for you or surprise you. You should be happy, of course, but the excitement should be limited because you will stress yourself during the excitement, and then at the end of the day, it leads you to crisis. So, what is the goal of management of patients? This is the goal. Our topic today is based on this. Is what? Prevention. Prevention remains the goal of today's discussion. Then another form of management is symptom control, and then treatment of complications. Now, once we know that, the best way to manage sickle cell disease is to be able to know the diagnosis early enough and to avoid denial. Some people will say, not my portion, not my portion, not my portion. Nobody is abusing you. Nobody is telling you black, but it has come to be. As far as you go to a healthcare provider who was able to diagnose this condition from you must follow it up regularly for monitoring. Now, you must be able to know how to manage vaso-occlusive crisis. This crisis that occur because of this abnormal sickling that blocks blood from flowing to the other part of the body. It can happen anywhere in your body. In your chest, the one we call acute chest syndrome. In your abdomen, leading to mesenteric ischemia, spleen, in fact, bone, joints, hip, they go all around. These things must be noted, and you must know it. Now, management of chronic pain is also important. Some people have been in pain for long, and some have abused drug. They have forgotten that this pain, you can live with it. And also, you need to know how to prevent and treat infection by all costs with malaria. For those of us who reside in this part of the world. Now, first of all, what do you need to do? You need to avoid dehydration, because I'm more of prevention than intervention. Prevention, it helps you to avoid the crisis. So you avoid dehydration. Fill up your bag with water. You can put vitamin C or vitamin C inside, but make sure you have water with you all the time. Take about 3 liters of water per day minimum. So go about it. Water. Don't be shy about it. I can assure you, I've seen people who have sickle cell. I've seen a nurse. She's a sickler. She's been working. I can't remember the last time she had crisis. She's working in a federal hospital. So you must avoid dehydration. That is number one. It is cheap. It is affordable. It is doable. Take your water all the time. Avoid abnormal positions. Some of you, when they want to sit down or want to lie, when they want to lay down on their bed, they put their legs on above their hearts, on top of the wall, pressing it on the wall. Forgetting, they just want to remain in that position. Or when they lay down, they bend abnormally. Or when you want to sit down in the chair, you don't sit down properly. So those things can trigger crisis because of what? Abnormal positioning. I've talked about excess of temperature. Avoid too cold or too warm temperature. You can stay under AC, but learn to off it once in a while. When the temperature is too cold, your blood vessel will constrict. There will be vasospasm. It will the vessel will constrict and there will be spasm because of that cold. And therefore, triggering what? Crisis and tickling. So we don't want to do that. So when you stay in a way that is cold, maybe in a bank, you tend to leave that place and come back. So that because you know your condition. Or don't be shy to tell people around you, I'm sorry, I endure cold temperatures. They will understand. They will understand. Avoid anxiety. Avoid identifiable triggers. Most people that have tickling have what we call aura. Aura, they tend to know when things is going, they tend to enter crisis. They will know, I'm about to enter crisis, maybe by the body itching them, or some sensation will start coming. They will know. So, because there is a trigger to that effect, particularly those who are asthmatic, who have sickle cell disease, they know their trigger. To avoid those things. Know your stress limit. I've talked about stress, and this stress includes both psychological stress and physical stress. Know your limit. Don't overdo yourself. Don't please anybody because you want to be seen to be hardworking. No, you end up going to hospital. Have your routine drugs handy. Every time you're going, there are drugs you should have. For example, painkillers. You know those drugs for those that don't have ulcer, NSAIDs like diclofenac, ibuprofen. You may have them with you. You may have vitamin C. You may have proguanil, the everyday drug you take for anti-malaria prophylaxis. We don't use primetamine again. So the one we call Sunday medicine again. We do the one of the current guideline by WHO is proguanil to prevent malaria, except those who are living outside the malaria endemic region. Now, know that how to go about it. It is very important. Have your drugs, have vitamin C with you, have water. Water is the best drug for every patient with sickle cell. Know your baseline or stable PCV. Know it and take your PCV routinely and know when you should what augment, because this issue has to talk about nutrition. So nutrition goes down. So when nutrition go down because of this condition, it means that you need to be eating hyper, increase in nutrition value. If it's like me now, I'm supposed to be eating maybe 1 egg a day, for example. For patients or people who are living with sickle cell, they can eat up to 3 eggs or 4 eggs a day. If you can afford it, you augment your diet. Now, some patients will need daily oral prophylactic penicillin for children up to 5 years, just to prevent pneumococcal pneumonia. So you might need those penicillin. Folic acid is important so that your blood formation will be augmented. But we don't take iron because iron is not the problem in sickle cell, but other nutrients. Now, I want to tell everyone here that there is a vaccine for malaria. It is important you know that there is a vaccine for malaria. For those of us that have children or give birth, there are 4 doses of malaria vaccine that you can take. It is normally started when the child is around 5 months. They will give the injection of the malaria vaccine. 5 months, 6 months, 7 months, and then the last one is at the 15th month. You give malaria vaccine to prevent what? Malaria. And it's for children. So tell your colleagues, tell everyone that if they have a child who end up having sickle cell, the child should need to be what? Immunized against malaria. And it will start from 5 months. It's a current trend that started this year in this our region. So please, we need to imbibe it and take it. Now, like I mentioned, analgesic is very important. At home, when you have crisis, I say there are different forms of crisis. But I emphasize vaso-occlusive. There are other forms like acute chest syndrome, where you have difficulty breathing, chest tightness, chest pain. There are other forms of crisis, sequestration. Your blood should be pulling within the spleen. Anemic crisis, the blood is low, so you find it difficult to strive. And then dizziness. Hand and foot syndrome is also a form of crisis. It's a form of vaso-occlusive crisis. So these crises come in any form. But the best, once it happens, once you start having pain, look for water and drink. I want to say it again. Look for water and drink. If you can take up to a liter of water, it will be good for you. Look for water and take. Look, if there's abnormal position, reverse back to a normal position. Maintain a good posture. Now, take analgesic, which is handy, which I mentioned. The analgesic could be opiates. Avoid injectable opiate because of dependency. I don't normally encourage people to take opiate because they tend to have addiction to it or dependency to it. And when you stop them from it, they have withdrawal syndrome. So, but paracetamol is okay. Now, take it at once. If the pain exists, as you are taking this drug, have it in hand to consult your doctor. And make sure you have an hematologist, which you know as your friend, any hematologist, because there's a special clinic for sickle cell patients. We don't want to mix them up with a general patient that comes to our clinic. So get one of them and always come in contact with him and call him or her. But if there's a problem, you may need to go to hospital. And sickle cell patients are not allowed to stay alone. You must be in a public where you be supervised so that help can be rendered at all costs. Now, I've mentioned analgesic, I've mentioned water and drugs that you take. Sometimes some people say, I don't like drinking water, doctor. I don't like drinking water. You can put vitamin C inside or Nutri-C so that it will reach you and encourage you to be taking it at all time. Now, there's what we call rest. Resting is a treatment. Bed rest is a treatment. And that is why when you come to hospital, when you're hospitalized, nobody gives you work. It's a form of bed rest. So learn to lie down and bring down your legs and lie down flat on bed. Because some people will lie down and raise their legs up, encouraging crisis to happen at the lower limbs. So when you lie down, take enough bed rest, take fluid, and then make sure you take your analgesic if you have them close by. For those that don't have ulcer, ibuprofen, diclofenac can suffice. You can augment it with paracetamol, but I don't encourage opiates. But at the same time, I don't want pain. So when I give patients opiate, I will tell them this is for the main time to avoid dependency because we have lost a patient, we have amputated hands, limbs in orthopedic because of drug addiction in a sickle cell patient. They keep on injecting themselves with these drugs. So for those who are asthmatic, hold your inhaler at all time. There's no shame inside. While at home, you're having chest tightness, wheezing, difficulty in breathing, or you are coughing. These four things, ensure you take your what? Your bronchodilator and use it. It can be in form of seretide inhaler or the salbutamol inhaler. Take it and make sure you do the needful. At the same time, for some people that have various form of complication like priapism is a painful, sustained penile erection. So the penis is straight, is erected, and it has refused to return back. Those ones will need to be rehydrated. You take water and then take analgesic. It might normalize back. Sometimes there are drugs we give them like the phosphodiesterase inhibitors. It will help them and then to return back to normal. But at the same time, we tend to distract them. You can enter a shower and take a warm shower if you have crisis. Enter the bedroom. I didn't say cold shower, warm shower. Pour water in your body. Drink water. You will see that the pain they take erythropoietin. Some persons may also need bone marrow transplants as a definitive treatment and gene therapy. So these ones will need to go to hospital. Remember that there is no shyness in this condition. All of us have one or two things we are managing in us. So if you have a wound, what about those that have wound? Leg ensure that these ulcers are taken care of. And that is why your antibiotic, you should not jump it. You must be taking your antibiotic at all times. For those that have eye problem, retinopathy because of sickle cell, you must be seeing ophthalmology. For those that have hip issues, ensure you go and see them. These things you cannot do it at home. But the ones you will do at home is the ones I told you. Rest. Take a warm shower, if possible. Take enough fluid, water intake. And I just that you have. Then rest. Maintain good posture. These ones are the ones you can do at home. But again, I keep hammering on prevention. We want to prevent those crises from occurring. It is the hallmark of if we obey prevention. For example, those that have not taken vaccine for malaria, take mosquito nets, use them once in a while. Insecticide, and then maintain a good environment. If you have any call, been altered, so I will be fine. I will be fine. God will heal me. Pastor will pray for me. My sister will massage me. These are the don'ts. I want to repeat it again. I never said that God does not heal. He does. But please, you must play a role. The idea about you having crisis at home, and then you forget to lie down properly, you forget to drink water. All you do is you pick up a Bible and start shouting, hitting your head on the wall. Oh, Father, oh, Lord, intervene. You are increasing your chance of having more severe form of crisis, because crisis can be mild, moderate, or those symptoms of crisis. And you sit down properly, you take enough water and analgesic, you take a drop, you will see that you make do with whatever you have. And when your blood is short, you may be giving blood transfusion. You're not taking blood for your life because you know your stable states and you know what to do. So please, don't form enmity with anyone. Don't be overly angry. Don't be overly stressed up. Don't attack anybody. Always be smiling and cheerful. Like my friend here, Kemi, which I know her then when I was in Ondo, Ikari Akoko. She's always smiling. If you see her laughing, you see her, you won't believe that there's any problem. So it has helped her. So she is a professional. I think she's really far better in this experience than me. But I am telling you that whenever you smile, you are happy. Remember, not overly excitement. You are happy. You are doing the right thing. You have your back on your back, not on one side. Take the two sides, put your back, put water inside. Take up to 3 liters of water, the minimum. For those that want to who are pregnant, therefore, no, immediately. You must both and for this year. The what will you do? Hospital. Then of the am I being heard? Am I live? Hello? Hello, am I audible? Hello? Can someone hear me, please? I hope I've not been talking to myself. Hello? 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 Am I being heard? Hello? Okay, you can hear me? Okay, I can see that they are saying yes, they can hear me. Okay, so I'm almost done. Okay. Somebody said I'm audible. Can you hear me? Okay, so like I said earlier on, don't know if you're hearing me fine. So like I said earlier on, sickle cell disease is not a death sentence. The point is that though it's a chronic illness, it's a chronic condition where there is a genetic disease, and it's not the fault of the person that has the condition. But symptoms of this sickle cell disease can be alleviated with early diagnosis. The earlier they diagnose the patient, the better. General improvement of health status by adequate diet, prevention of crisis through health education, and regular medical follow-up, and ultimately can be prevented with what? Premarital counseling. So the idea about I love you, I love you, I love you, please go for medical marital counseling. Make sure you're on the right track. Tell people, yes, even when you may feel it doesn't concern me, but you may have friends who have AS or who have one form of or SC. Tell them, don't shy away. You are part of the worldwide medical family of which we treat a patient. So please speak to people and tell them the condition. Tell them that look, this condition is preventable. It's better what? Preventable than treated. And when it has come to be, it is not a death sentence, but rather it is an avenue for knowing oneself and doing the right thing at the right time. So I think I have to stop here so that I will, if there is any question or comments, I will welcome that. Hello? Hello, Mrs. Kemi. Are you still here? Hello, Mrs. Kemi. Is there any question? You can put it in the comment box. I can see you. I can see you. Can you see me? Yeah, I saw a question. Somebody say my child do bedwets at age 13. What can I do, please? Okay, I want to believe that this child has a sickle cell anemia before you should bring it here, because our this program is basically for sickle cell parenting. Sickle cell parenting. So I don't know. Is this child? If the child, so if the child is 13 and is still bedwetting, what it means is that we call it neurosis. Neurosis. Uneureuroesis is a pediatric psychiatry issue. that you may need to see him. There are many ways you can train him from stopping that. But usually by 13 he should have stopped it. But you need to do what you call behavioral therapy training through movie. You teach him how to control himself. Maybe you get a movie on how and the consequences of bedwetting. Then you can bring someone roughly at the same age who will be cautioning him or his siblings. And then you might learn to teach him on how to urinate before sleeping. And at the interval, you might need to wake him up to go and wake him up in the midnight to go and urinate. And at what and anytime he does well, give him an award. Get him something he likes. You want to keep up to that so that you want to prevent that bedwetting, because there is something good he will get if he does the right thing. So if those ones fails, you will most likely see a pediatric psychiatrist that will help him. Now, another question is, please, what cause leg ulcer and ways to prevent it? Yeah, leg ulcers in sickle cell disease are caused when there is what? Crisis, particularly vaso-occlusive crisis. So if the blood flow, because leg ulcers could be either arterial or venous ulcer. We call them vascular ulcers or ulcers due to hemoglobinopathy. Now, those persons who have those ulcers because of repeated vaso-occlusion, blockage of blood flow, and before you know it, they put pressure on that part, and there will be wound or a sore. There will be a wound or a sore, and before you know it, the individual will would tend to be doing some native or non-orthodox practices on that, pouring powder or doing self-treatment. But because the person has not identified the cause, that this is what? Vascular ulcer from hemoglobinopathy. So the ulcer will persist, and most ulcers of sickle cell are chronic ulcers. So it's due to the what? Prevention of blood supply to that particular part. Then persistence ischemia or blockage of blood supply will now lead to necrosis or cell death. From there will be a sore. From the sore, it will rupture. From rupturing, it will form a wound. From wound, it will become an ulcer. From the ulcer, it will become a long-time ulcer that will become a chronic ulcer. Now, so that is what causes ulcer. And the way to prevent it is that learn to be changing position while lying down. Stop lying down on a fixed part of your body. If you lie down on the left, change to right. Be doing bed turning, because the more pressure you put on a particular part of your foot or leg, and if there's bone there, bony prominences, the likelihood that it will ulcerate. But when it is now established there's an ulcer, please avoid traditional bone setters, avoid traditional people, avoid traditional people, avoid prayer house. Look for a way and go to a hospital. Now, the next question is, what specific age is malaria vaccine advisable? Yeah, from the lecture I presented now, I told us that from 5 months, the moment a child is born, 5 months, the WHO have allowed malaria vaccine to be given. Total of, you give 4 doses in the 5 months, you give another 4 doses 6 months, you give another 4 doses 7 months, and then the last dose is on the 15 months, where you give 4 doses. It is injection. They will give it at the dentoid region. Dentoid region. That's where they will give it. It's to prevent malaria. Is there malaria vaccine for adults? Yes. For adults, I think they said there is, but the one that we are very sure of, according to the extended NPI schedule, is for children under their routine immunization schedule. What causes limping in sickle cell? Yes, a lot of things causes limping. Number one, and the commonest, is avascular necrosis of the hip. When the head of the femur died of poor blood supply, we call it osteonecrosis. So the blood supply does not get to the head via the neck. So the head will pull out and leave the head. And because blood is not getting to the head, it will die off. It will undergo atrophy and die. Sometimes you do X-ray, you will see the head of the femur. So we call it avascular necrosis. Avascular means no blood vessel supplying the head, and the head will now die for what? Necrosis of the head of the femur. So that's the commonest cause of limping in a child. There are different stages we use. There are many classifications, Ficat in Alats or ICO. We classify. So people are in different stages of avascular necrosis. Some are in the early stage, they will limp. Those in the late stages, there's nothing you will do but to do hip replacement surgery by orthopedic surgeon or arthroplasty surgeon. So that is the commonest cause. The other causes could be recurrent hand and foot syndrome or vaso-occlusive crisis affecting the foot or ankle. But the commonest that leads to limping in a child, once you see it in a child with sickle cell, it is usually an orthopedic condition. The next question is, please, is there any particular food or nutrition that an adolescent person be placed on? Yes, food, nutritious food. Eat well. Banana, eat fruit, eat good food. Avoid alcohol. If you drink alcohol, avoid it. Don't go near, avoid smoke, avoid excessive cold. Eat good food. Don't drink cold water. Excessive cold water will cause you a problem. Normal water is okay. Go about with vitamin C. Take a normal diet. There is no need. And then your anti-malaria is important. Please, I want to know if hydroxyurea cap is good for sickle cell patient. Hydroxyurea, we know what it does is to trigger the formation of fetal hemoglobin, just to increase the amount and then reduce crisis. Uh-huh. So we don't just go and buy it. There are people who are qualified to take it. There are those who are not. So, but the essence is, if you can afford it and it is being prescribed, you can get it and be using it. Some people have abused it. They forgot that it is a nucleotide analog because of the urea it has. My child complains of joint pain after bathing if she doesn't wipe the water away. Wow, I'm trying to link this one to joint. Anyway, it depends on the water. Now, if you complain of joint pain there can be minute crisis going on there. But the water in our body, touching our body and the joint is not, there's no relationship there. So I think it's more of psychological. There's no direct relationship between water in our body and painful joint. So I think there is another cause that you might need to find out. But if she said if there's water in her body, then clean it up, wipe it out. And so why always get her a towel to wipe it out so that she'll be happy. Please, is the name of that malaria drugs they need to take? Please, the name. Okay, proguanil. You take proguanil daily to prevent for if you are if you are having enough mosquito in your area. But I will encourage you to avoid mosquito. Make sure your environment is devoid of grass, lake, water collection. And then use mosquito insecticide treated net to sleep. What information can you provide about using Rodrin for a child of 3 to 5 years? Well, it can be used, but at the moment, that child, if it's not yet vaccinated, go and vaccinate that child. Go and vaccinate the child on the malaria, but you can't use it. Please, my nephew of 8 years was placed on hydroxyurea 500 milligram. Wait, I don't know if this is a comment or a question. Sorry, is that a comment or a question? I hope I'm answering your question accordingly. Oh. Hello? I have to reply some people's because I have something I'm going to do now. So hello? Hello? Sorry, Mrs. Kemi, I can't hear you. You are talking, but I can't hear you. Hello? Okay. Your question is I'm being distracted. Your question is my nephew. Okay, the doses are okay for the dose. The dose of hydroxyurea is 15 milligram per kg per dose per day. So if it's weighing, you multiply 15 by 27 and check. If it's in line, it comes in 15 milligram per kg. So if you get it that way, then you're on the right track. So per day, you need to take 15 milligram per kg. So if it's weighing 27, so you multiply it by 15 and see if it's too much. That will guide you in that aspect. Okay. She says you private chatter. Okay. Okay. Can stress induce malaria? No, stress does not induce malaria. Malaria is caused by female Anopheles by Plasmodium, which is transmitted to you via an infected female Anopheles mosquito. So stress does not cause malaria. Malaria is caused by a parasite, Plasmodium species, which could be Falciparum, malariae, vivas, ovale, or nocii. There are 5 of them. Malariae, vivas, ovale, nocii, or Falciparum. Falciparum is the notorious one. So this is the one that can cause malaria. Yes, it's possible to have malaria even when you use mosquito nets. When you come out in the morning to brush your teeth, mosquito can come and tell you good morning. And from there, while you came out to brush your teeth, mosquito can come and bite you. And from there, you have malaria. Even while you're walking on the road, you go to buy something somewhere. Because mosquito can be endophilic or ectophilic. Those that stay indoor and those that stay outdoor. So there are different groups. Okay. I don't know any more that I have an appointment, so I'm trying to meet up. That's why I'm distracted. So stress does not cause malaria, please. Stress does not. And it's possible to still have malaria despite being on mosquito-treated nets. When you step out to brush your teeth in the morning, an innocent mosquito will come and just bite you. So, in absence of any further question, I don't know, can we What usually causes infection in sickle cell? A lot. This is a big topic. The white blood cells does not go there to fight because there's a block due to sickling. So the person is prone to infection. So there is blockage of blood supply. So the blood supply is poor. Stasis. Blood stays in one place. There is dehydration. Those conditions makes the body to effectively go there and send soldiers to go and fight. So these are the things that can trigger, cause infection. There are so many of them. Incident infection, like I just mentioned, a lot. Exposure to bad environment or people that have conditions like that. Okay, I don't know any. Okay, this one. Is there any formula for calculating the use of paludin? Is given usually for children 100 milligram or prophylaxis is 100 milligram daily, but when the condition is as you can take up to 200 milligram. Yes, paludrin is also called is a proguanil, is a market name or paludrin. The other one says what are the causes of incident infection and why is white blood cell high in crisis? Because the blood is short, is concentrated. There's dehydration, so there's a concentration. So the blood is concentrated. It's thick. Blood is kind of thick. So the white cell count will be high. That is one. Two, because of the infection ongoing, the body is trying to mobilize soldiers to go and kill the infection, and also making the white cell high also. So these are the factors that will increase the white cell. So please, with the permission of the house, I may be taking my leave now. I have another engagement now. Please, I need to meet up with a meeting somewhere, but that meeting will be physical. And so, I don't know. Any other point, we'll talk about it other time. So thank you so much. Mrs. Kemi, your voice, you are muted. You're muted. I don't know if it's because of your network or how, but you're muted. So I want to leave you. So thank you so much, everyone, for this time and then for having you with me. And so hopefully other time we might need to see or we'll see physically. Thank you so much. And do have a wonderful time. Bye.
If you can hear me, please let me know in the comment section. Can we hear me? If you can hear me, please let me know in the comment section. Can we hear me? Thank you so much, Dr. Shuku. I thank you so much. Thank you so much. So we are bringing in the next speaker for this event. We are bringing in coach. Is a parenting coach, somebody that has worked with a lot of over 1,000 teens, both one-on-one coaching. He has led a lot of youths. He knows how to work with them, their when positive mindset, emotions, how to regulate their emotions, and every other thing. I'm bringing to us Coach Nuhu. You know, Coach New and I belong to some of these some platforms, and every time coach is actually talking about teenagers, talking about their emotions, talking about how we parents was supposed to do this. I will always have it. Ah, no, this year parenting conference we must bring in coach, and then God has helped us. Coach decided to say yes to us. So I'm extremely excited to have you here, sir. Welcome, and then the floor is yours. Thank you, sir.
Thank you so much. I'll call you Auntie Kemi. Is that okay?
Yes, any name you call me is okay, sir.
Okay, thank you so much for this privilege to be here, and it's such a very pleasant time to. I mean, I've been listening to Dr. Chuku, and believe me, my mind is blown away. Just with the things that he shared, and it's such a privilege for me to be here today. I'm so blessed. Thank you for the opportunity, Auntie Kemi, for allowing me to be here, and also that I could share with these amazing parents. And to the parents, let me just begin by saying thank you so much for being here. Because the truth is, for the fact that you have chosen to be here today to be a part of this conference, what it means is that you are intentional. What it means is that you are purposeful, and what it means is that you want to do things differently. You want to connect with your children in a way that you probably didn't have the opportunity to, when you were growing up as a person. Now, with sickle cell disease or not, children need that parental connection. So I really admire you, because you're actively looking for ways, to connect with your children. Thank you so much, especially in the unique challenges that you face with your children. But again, thank you so much for being here, and thank you, Auntie Kemi, for the privilege. So let me start by saying, um, I understand that raising a child with sickle cell, is not something that is easy. Okay, it takes a lot of strength. It takes a lot of patience. It takes a lot of love. But the good news is that there are simple and practical things that you can do as a parent, to be able to build a deeper connection, right, with your children, even in the midst of these challenges. Okay, so that's what we'll be talking about today. Now, think about it, that I'm giving you some practical approaches, and you'd find out that in your relationship, I'm giving you a toolkit. Let's put it that way. I'm giving you a toolkit that will help you to strengthen your relationship with your child. Now, the idea is little habits here, and little and approaches that you can immediately practice or put into use over time can make a huge difference in your life. All right, so we're going to continue now. So let's talk about, first of all, understanding the emotional landscape. But before then, for 3 days, today is going to be the third day. But for the past 2 days, not consecutively, anyways, but from Monday and Wednesday, I've been taking parents on this same idea of emotion, of connection, or building deeper connections with their children. And believe me, the strategies and ideas that I'm sharing are things that immediately they put it into use, they're beginning to see results immediately. Like, we talk about it today, and then tomorrow they put it into use and they're beginning to see results. So today is going to be the third and final day, for that particular webinar. So it's a 3-day webinar. We did on Monday, then on Tuesday we took a break, and then gave them practical things that they needed to do. Then we met on Wednesday and took a break, gave them practical things to do, and today we're wrapping up. So believe me, parents are looking for ways to deeply connect with their children, and most times we don't know it. We don't know how to do it, and so it can be challenging. So first of all, let's understand the fact that our upbringing plays a very powerful role in how we parent our children. Now, in Africa, typically, parents don't really connect so much with their children. There isn't so much of um, of that deep connection. The relationship is really just on the surface. It's all about, providing the physical needs of the child, food, water, school fees, all of those things. And usually that's where it stops. But there isn't so much about going deeper to connect emotionally with the children. And because of that, you would see that there is a huge relationship problem. There's a huge relationship problem between parents and their children. Okay? There's a huge, huge, huge relationship problem. And so that's what we want to talk about. We want to look at how you can actually build that particular relationship in a way that you can get that deep connection with your child. So first off, you would need to, I mean, that's even another workshop that I take parents on separately. But one of the first things you need to do is to first of all assess your own upbringing. Many times, the issues that we have in relating with our children are things that are baggages really that we brought from our own parenting, from the way that we were parented, rather, right? So because my parents didn't really spend time with me, it just grew and became a part of me, to the point that I don't see connecting with my children as anything. It's not something that parents do. In fact, children are only to be seen and not heard. That's the idea. That's the environment that most of us grew up in. And so it's very easy for us to translate that even as we parent our children. And so it's important for you to first of all assess, look at how you were brought up. How did you experience, how were you brought up? And ask yourself the question, the way I was brought up, is it the same thing that I want, the same way rather that I want to bring up my children? Now, let me give you a short visualization exercise. If you just take a minute, right, and think about your child in the next 20 years, if your child is below 10, or maybe in the next 15 years, or maybe for some of you it's in the next 10, in the next 5 years. Imagine that your child is parenting their own children the same way that you are parenting them. Does that bring a good picture to you? Is it something that you're proud of? If you imagine your child, just closing your eyes and imagining your child parenting their own children the same way you parent them, is it something that would bring joy to your heart? If the answer to that question is no, then it means that you need to also look back. You need to really pause and ask yourself, the way I am parenting my child, is it actually truly serving my child? Is it serving my child to become the kind of person that I want them to be? The kind of person that ultimately God wants them to be? Is that it? That's the question that you need to ask yourself. And that's why we're having this session, so that we're able to really know what to do. Okay. So first of all, let's understand the emotional landscape. Okay. Now imagine that your child, or imagine being a child rather, right? And then you're dealing with this frequent pain, frequent hospital visits, and you're missing out on activities that other children are actually missing out on, right? Other activities that children take for granted. Now it's not just physically tough as a person for you, if you imagine it. It's emotionally draining as well. Okay, so of course your children who are dealing with sickle cell might feel very scared and afraid. They might even feel frustrated because there are things that they cannot do, or maybe that you have placed a you've restricted, basically, that they can't do because of their unique situation. Sometimes they might even be isolated. Let me give you an example. Imagine your child saying to you, "But why do I have to stay home and not go for John's birthday party?" Right? Imagine your child saying that. Now, that question alone can come with a lot of sadness. It can come with a lot of anger and even a sense of unfairness, because the child is looking at himself as, why shouldn't I be able to attend this? Why shouldn't I be able to be a part of this particular birthday party? Right? So the child's looking at it from the child's perspective, you would see that the child is going through a lot of emotional stress. And you, as the parent, if you are not in a place where you're able to truly understand, right, that this child is going through a lot of emotional stress, if you're not well equipped, you would not be able to help the child to intentionally deal with this and find ways that would actually help him cope. So it means that you need to be intentional about, first of all, understand your child's perspective. Now, the second thing is to also look at your own perspective as the parent. Look at your own perspective as a parent. Now, on your own end as a parent, it's a constant up and down. It's a constant, yeah, absolutely ups and downs, right? Because there is fear, constant fear of their health. What is going to happen? Is my child going to make it this time? Is this the end? Is it going to get worse? You constantly having that fear. There is a lot of guilt. You feel, as parents, we know that what part of our role is to provide for our children, to be able to give them the things that they need and the things that they deserve. But for the fact that you cannot do anything regarding your child's health, it can bring a lot of guilt to you. And the fact that you cannot fix everything, it comes with a lot of guilt. And I can imagine you going through that. Of course, there's also a lot of emotional exhaustion. You're constantly exhausted emotionally. You're drained as a caregiver to your child. And so these feelings, I want you to know, everyone here that's listening, that is watching me, these feelings are completely normal. And I know that, again, in our traditional African context, when you express such feelings, the society or people, even your friends, could tell you, you don't feel like that, just leave everything to God. Absolutely, we leave everything to God. But these are real feelings that we're having. So I want to let you know today that those feelings that you are having are perfectly normal. Okay? But I want you to know that it's important to acknowledge those feelings so that they don't silently build up and then cause even sickness to you as a caregiver, or get to a place where they more or less, like, it just bursts, and then it can come with a lot of other issues. So your perspective as a parent, I understand the fact that that it can come with a lot of emotions to you as well. So it's because of that that we need to build one very crucial thing for both you and your child to be able to connect, to build a solid relationship together, and that is the idea of empathy. I believe without any doubt in my heart that there is no parent, or there's no parenting that can be done and done well without the element of empathy. Any parent who does not have empathy towards their child, you see that check their relationship, you would see that there is a gap in the relationship. Empathy is a huge foundation for you connecting with your child and for you building, an emotional connection. Okay. So again, today we're talking about the idea: how do you nurture trust and understanding even as you parent your child? And so what I'm saying to you is that empathy is a foundational value, of a foundational character that you would need to develop, okay, as you move forward. So the idea is putting yourself in their shoes. Now, let me explain what that means, because when we talk about putting yourself in somebody's shoes, we misunderstand what that means. Sometimes we can say we're putting ourselves in somebody else's shoes while we are still remaining in our shoes. And that's not what I'm talking about. I'm thinking about I'm talking about how you can literally just look at the world of your child who is suffering from this unique situation of sickle disease. You're looking at them through their own eyes, or being able to put yourself, and look at life through their own eyes, look at life through their own perspective. Now think about how scary it might be, how frustrating it must be to constantly be injected with needles. Or think about how frustrating it will be to constantly be left out on the fun that every other person is having. When you show your child that you truly understand, or you truly get their struggles, what it does is that it creates a bridge, of understanding between you two. And believe me, parents listening to me today and watching, empathy would set you up on a very powerful level of connecting with your child. Okay. So now we've set the stage, right, for this conversation. Let's talk about some of the practical ways that you can take, some of the practical things that you can do, okay, to help to build and sustain that connection. Number one is the idea of validating them, and also, actively listening to them. Now when we talk about validation, is exactly like what I did a few minutes ago. I told you that the feelings that you're having, the feelings of frustration, the feelings of anger, the feelings of sadness that you may feel as a person, as a parent, as a caregiver to someone who is struggling with sickle cell, um, that's validation, saying that it is okay to feel that way as a caregiver. That is what I mean by validation. It means that when your child is having to go through all of these things, you are right there to say, you know what, it's okay. Now, have you ever had a day that you wanted to just vent out? And I'm going to talk to you here as a parent. Having a day that you just wanted to vent out, to talk about the things that you feel, right? To talk about the things that the pain that is going on in your heart because of having to care for your child who is struggling with this sickle cell disease. You want to just have somebody listen to you, or you begin even sharing about the frustration, and somebody said, you know what, don't worry, you'll be fine. Don't worry about it. You know how frustrating that can be, because what that person has successfully done is to completely shut you off. That person is not validating your emotions, is not validating your feelings, is not validating the things that you want to express. So it's the same thing, that when your child is going through those pains, going through the crisis, going through the struggle that comes with this particular disease, and you brush off those feelings and you just make them feel as if you're old now, you're old enough, why are you complaining about this thing? When you do things like this, it will crush your child, because then they feel as if mommy or daddy or my caregiver does not really care about what I am feeling. Okay. So you need to validate their emotions. For example, if your child, because of, again, the constant visits to the hospital, your child tells you, mommy, I'm really afraid about going to the hospital tomorrow. Let's assume you have a scheduled appointment with the doctor, and he knows it's tomorrow, and he's saying, mommy, I'm really afraid. Those needles, I don't want the doctor to inject me again. I'm tired of having to face these needles. Instead of just saying, but you've done this thing many times, why are you afraid? You should be used to it by now. That would be, again, crushing your child's feelings. What you can do instead is to say, John, let's assume your child's son is John. You say, John, I hear you. And it's okay that you feel afraid. It's okay that you feel scared. Okay? And a lot of other children feel the same way as well. What you're doing is you're validating his feeling. You're letting him know that it's very okay to feel that way. Again, in our African parenting, there's what we do, that we try to make our feelings not, we try to downplay our feelings. Again, that's what most of us have grown to learn, because we've experienced it. So we don't allow children to express what they feel. But you want to let your child know that, you know what, I understand. Or you maybe not necessarily understand, but let them know that it's okay to feel whatever it is that they're feeling. Other children are also feeling the same thing. Now, when you do this, you're letting the child know and understand that, okay, I'm not alone in this. There are other children as well. So again, instead of just allowing that to just, you know just push everything aside, tell them know that, hey, let them know it's okay. Hospitals can feel very overwhelming. I understand that you might feel scared, but you know what, I'll be right there with you. What you're doing is you're validating their feelings, number one. Number two, you're assuring them of your presence. Again, one of the best ways that you can connect with your child is when you are present in their lives, not just physically present, but emotionally present in their lives. Now, when they talk, you want to make sure that you listen, that you actually listen to them. They're not talking and then you have a phone in your hand, you're pressing and you're saying, are you serious? Oh, wow. No, when they're talking, you want to give them your full attention. Let them know that you are present, you are there with them. No interruptions, just your undivided attention. Now, in the webinar I'm currently taking parents, again, one of the things that we talk about is this, that you spend, and I'm going to just give you this as a tip, that you spend 10 minutes at least a day with your child, undivided attention. You give them your full attention for only 10 minutes a day. Begin that, and you would see that would begin to solidify your relationship. Now, the second thing that I want to talk about is to create that safe emotional environment, that safe space for your children, or for your family, basically. So you want to let your children know that it is safe for them to talk to you about anything, anytime. Now, if your child understands that they can talk with you and share anything at any time, what that does is that it begins to break down those barriers of connection, and it helps them to begin to open up to you about things that are going on in their lives. It's possible that there are many things that they're even struggling with, some thoughts they're having in their heads that they may not want to share with you because there isn't an emotionally safe space in your home yet. And so they don't feel that I can talk to mommy. They don't feel like I can talk to daddy about anything, about this particular thing. Yes, I can tell daddy about my crisis, but what's going on emotionally, the thoughts I'm having, the negative thoughts I'm having in my head, I cannot share it with them. It's possible when you don't have an emotionally safe space for your children, believe me, they won't share those deep emotional things that they're going through with you. So you want to put aside, again, a few minutes every day. You want to talk about them. How was their day? What are they feeling? What's going on with them? Just making them to understand that you are there for them. And for those times, right, for those moments where you feel like they're not able to express in words what they're feeling, one of the ways to really help them to express their feelings is to help them to write. Okay, not help them to write, provide something for them to write. They can keep a journal. You can keep a journal. And for younger children, they might even, you can just give them a safe space that they can provide something for them to draw or to color or to paint. Again, the idea is that what is going on in their hearts, in their minds, comes out, whether through speaking, through drawing, through writing, or through painting. However they're able to bring out what they're feeling, It's very, very crucial. But you have to create that environment. You have to create that space for them, first of all. So it's important for you to be able to find a way to create that safe space, that emotionally safe environment for them to express what they're feeling on the inside. Now, the third thing that and we can talk about, again, we're talking about building emotional connections here. The third thing that can help is we're talking about trust, right? We're talking about building trust. Building trust, and building trust through being consistent, basically. Now, children naturally, they thrive and grow so much when things are predictable. When things are predictable, children actually thrive. So the idea is that if you tell your child that you're going to do something together with them or for them, it's very important for you to follow through. It's very important for you to do it. If you're not able to, for some very tangible reasons, then you want to let them know that I cannot do this. And then you reschedule. As I'm talking to you right now, my daughter is having their Christmas carol in their school. They're having their Christmas party as they wrap up for the year, and I'm not there because I'm here, right? So, but this is something that we're supposed to go together. You see, the fact that I am not there with her, I told her that I cannot. I'm sorry that I need to be in a meeting, that I cannot come with her. But you know what? After now, I am going to have some time with her alone. Take her out somewhere, or go and do something special with her because I missed this particular time. And so it's the same thing. When you are not able to follow through, you would find out that children will lose trust in you, especially if you don't come back to explain the reason for you not following through. So for those, if life gets in the way, again, life, there's a lot going on in our lives. There's parenting, there's work, there's relationships, there's family, there's a lot going on. And so when you're not able to follow through, please, again, explain the why to your child. And if it's something that you can reschedule, then please go ahead and reschedule it. Okay? Trust is built with your children when they know that you will keep your word. So yes, I understand. I know that you're going through a lot, but please, when you say something with your child or to your child, please make sure that you follow through with it. And again, if you cannot keep it, then if you're not able to do it, then please, always reschedule so that they see daddy and mommy as people that they can trust. I remember that whatever we do, we are modeling it to our children. Whatever we do, our children are watching, they are seeing, and that is eventually what they will also begin to practice. Because truth is that they catch more of what they see than more of what they just hear, more of what you just tell them to do. Okay. So, but how do we, moving on from here, how do we nurture that understanding and resilience, right, as they pass through, or as they have to go through sickle cell, as they have to go through the struggle of sickle cell? Number one is help them understand what it is. It's very possible, and many parents would not explain the condition to their children, right? They don't explain why it is that they constantly fall sick. You want to help your child really understand their condition in a way that they're able to understand, right? In a way that they get the point of why they are constantly, falling sick, or while they have routine hospital visits. For the little ones, those that are very, very small, you might just say something like, you know what, your blood cells are shaped differently. And so sometimes they just get stuck and make you feel tired or feel pain, right? Just for younger children. But for those kids that are older, you can just explain the details to them. But the idea is that you want your child to have an understanding. They need to know why it is that they go through pain more than other children, more than their friends usually go through pain, or why they have to visit the hospital frequently, or why they have to refrain from some activities. They need to know that. Don't say they are too young. Don't say they are too young. Believe me, these children, they have emotions, and that's one of the things that we're talking about in the webinar that we are wrapping up today. Sometimes we feel like our children do not have emotions, but believe me, they do have emotions, and so they need to understand why it is that they face all of those pains and isolation sometimes. But another powerful thing that you can do for your child who is struggling with, who is having to deal with the sickle cell disease, is to help them to reframe the challenges that they're going through. And as a coach, when I work with young people, when I work with parents, one of the most powerful things that I help parents to do is to reframe. You see, there's a lot about mindsets that affects everything that we do and truly everything that we become, right? So one of the things that I see very much with parents is they believe something about their children. So the truth is that whatever you believe about your child, believe me, your actions will follow that belief. Whatever you believe about your child, your actions will go in the direction of your belief towards your child. If you believe that your child is already defeated by the sickle cell disease, believe me, your actions will follow through based on your belief. And you see that maybe you are not giving them enough time, or whenever the crisis come up, you're probably being lackadaisical, or you engage with anger and all of that. But if you believe that your child can actually pull through this, if you believe that your child can manage this and live even better than other children who are struggling with the same disease, believe me, your actions again will follow through. You would see that the way you engage them will be different. You would see that the way you take care of them, the way you nurture them will be different. So you want to, first of all, as a parent, be careful what you believe about your child, because it is very powerful. Your belief about your child is very, very powerful. So you want to watch out what you believe about your child. So as you reframe what you believe about your child as a person, you also want to help them to reframe the challenges, right? Or the setbacks, the pain that they're experiencing. You want to reframe them and turn them into opportunities that they can use to actually grow in their lives. For instance, if they're very sad or angry because they're sick, and they're not able to go to school, or they're not able to do a school, maybe a fun thing that's going on in school. Again, you validate. Remember, we talked about validation. So you let them know that, yes, I understand, John, that it is difficult. It's not a good feeling for you to miss out on your school, let's say drama, or your school carol, for instance, right? But why don't we use this time to do something special for when you get better? You see, what you're doing is you're taking the fact that they're not able to be present in whatever other activity, and you want to turn it to do something special with them. It could be as simple as just sitting down to read to them a story, or asking them questions, or sharing about your childhood, or asking them things that are important to them. Many times we assume that we know our children. Many times we assume that, oh, this is the child that I change diapers for. This is the child that I pay their school fees. This is the child I take to school. This is the child I take to the hospital regularly. Oh, I know my child. But truth is that many of us don't take time to truly know our children. again, I was talking to parents recently, and I was asking them to do this exercise where they just go and sit down with their children and spend the entire 10 minutes of their time just asking the children basic questions to understand their children. And believe me, they were shocked about the with the results that they got, with the answers that they got, things that they never knew that their children were interested about. They heard them. The children said it because the parents took time, kept away all distractions, and just stayed with them. So during this time, if there's a challenge that they're not able to do something that they normally because of they're sick, because they're not able to, maybe they're on medication, and all of the crisis situation, you can use that time to do something special. Give time to your child. Hear from them. How do they feel about the fact that they're not able to do that activity that everyone else is doing? What is going on? What are their hopes? What are their dreams? Have you ever sat down to talk to your child and ask them what they think the future holds for them? Think about it. Think about it. So it's important for you, again, to help them reframe. Now, one of the powerful ways that you can help them to reframe is for you to also learn to reframe, like I said, yourself, okay? And that will model it for them. The third thing that you can do is to, create those moments in your family where you're able to really bond together, where you're able to bond together. For example, if there's a particular day that they go without any pain, or maybe they are able to complete something that they started doing, maybe a project in school and all of that. What you want to do, make it a big deal. Make a big deal out of it. If they go through a day or through a couple of days or through a week without pain or without extreme pain, help, like, as a family, you should make a big deal. You should make noise about that. Let them celebrate it. Celebrate even those small wins with your children. Again, what it does is that it helps your child to find things to be grateful for. And that's one of the powerful things that you can help your child to do, that they see that I can be grateful for something. Many times we are not grateful for the things that happen in our lives, but you can help your child to actually celebrate, to make it a big deal if they achieve a certain milestone. I remember, the idea of fun, just having fun with your family is very crucial. There are a lot of things that you can do. You can have board games that you can do together, off the screen. Again, it doesn't have to be something that will cost you a lot of money. Okay, you could play board games at night and just connect in a very, very meaningful way. That way, as you're playing the games, you're connecting. Believe me, you're also getting to understand certain things and certain characters, certain values that your child has, that you can actually celebrate as well. Okay, so those are some of the ways that you can actually help your children to be able to build resilience, in their lives. So, but what are some practical things that you can do, to build everyday connection? Everyday connection. Now, one of the first things I talk with parents about is the idea of quality time. The idea of quality time. Many times you find out that parents are in the same space with their children, right? We could be in the same space for 1 hour and never connect deeply with your child. But you know what? You can spend 10 minutes, 15 minutes and connect with them at a level that 1 hour may not, especially if you're not present. So the idea is that you want to be present. So you don't need many hours. Just a few meaningful minutes can make a huge difference for your child and for your relationship with your child. So it's just as simple as, like, one of the things we do with our daughters is that we read with them every night before we go to bed. They go to bed somewhere around 8 o'clock. So by the time it's like 7:30, we're already beginning to prepare and wind down for the night so that they're in bed around 8 p.m. Okay. So what do? We read together. We sit down on the bed and we read together. So you can create that, something like that with your child. Again, it doesn't have to be I mean, like what I do. You can find out what works for you, but the idea is that you spend quality time and make good use of the time. Okay, good use of the time. So quality over quantity. When you are spending time with them, make sure that you are present. Be present with them. Okay. Now, the second thing is that you want to remind your child that they are so much more than their condition. Again, remember what I said earlier on. What you believe about your child, what your mindset is regarding your child, will affect every other way. Will affect every other thing you do towards your child. So you want to let your child know that they are more, so much more than their condition. Let them know that, and let them be repeating it to themselves. Okay. You, when your child is kind, you want to compliment him. When he does something creative, he draws or paints, you want to compliment him. When your child is resilient and is able to just goes through a particular crisis, you want to compliment him. For example, you can say something like, "Oh, I noticed how you helped your sister with her homework today. That was really thoughtful of you. That was a great thing that you did, John. Thank you so much for showing kindness or demonstrating kindness." You want to encourage them personally for every good thing that you see them do. Okay, let them know that even though they have a medical condition, it doesn't stop them from having values. It doesn't stop them from doing something good to someone else. Okay, so that they don't feel as if they're a sorry case, so that they don't feel as if they are only people who should keep receiving all the time and never give. That they don't give into self-pity. Again, please listen to what I'm saying. Your mindset towards your child would determine how you engage them. If you build self-pity in your child, believe me, your child will grow up to see themselves as somebody who has nothing to offer to the world. But your child has so much more to offer to the world. Your child has so much more to offer to those who are around them. But it depends on how you, as the parent, let them see themselves. When I talk with people, young people love to be around me, and one of the reasons is because I make them feel good about themselves. I make them see themselves not as a problem. I help them see themselves as people with potentials, as people who would make a difference in the world. And one of the reasons why they like to hang out with me is again because of that. And so when I talk with parents, I help them to understand that you need to make your child understand that they are powerful, that they are very special, that they are unique, and they have gifts that the world needs to see. They have gifts that the world needs to experience. So encourage your child personally, one on one. Take time and spend with your child to let them know that, you know what, you are beyond this condition. There is a lot that you can offer to the world. Again, one of the other things that you can do is to model how you can cope. The idea of modeling coping mechanisms. Now, if they're going through a crisis, believe me, and the way that you behave around them, right, has negative attitudes, has a whole lot of negativity around it, believe me, you're going to transfer it to your child. You're going to translate that to your child, because remember that you are the primary source of knowledge for them. You're the primary source of the things that they know. So whatever they see you as a parent do is what they will reflect. In fact, somebody said that parenting is that your children are the result of your parenting. It's like, the results we get in school, right? Your children are your report card. I think that's the way they put it. They're your report card. And the idea is that all the work that you've been putting as a parent into your child, whether it's good or not, you would see it reflected in your child. So you want to, please, parents, take time to model very good coping mechanisms for your children, because your kids again learn by watching. So if you're feeling stressed, show them, how do you handle it? How do you handle stress as a parent? Do you take some time off to just breathe, or to do something that gets you off that stress, do something in the kitchen, do something fun. What is it that you do to manage stress in your own life? For example, remember, they are watching you, so whatever you do, they will model after you. So you want to model something that would serve them. We want to model something that would benefit them as they live their lives. Remember that they're not going to be with you forever. Okay, they're going to grow, they're going to go move to school, they're going to have to live at some point, in by their own. They're going to grow, they're going to get married, they're going to have their own families. So you're not just parenting your children for them, but you're also parenting them for generations to come. So the kind of way that you show them how to cope with things. How do you cope with pain as a parent? How do you handle anger? How do you handle stress in your life? You want to show them and model it the right way so that they're able to follow in your example. All right. So I hope you're following me. If you're following me, just I'd like to just drop a comment. Just drop a comment if you're following me, so I know that we're together. All right, good, good. Thank you, thank you. So, um, let's move on again. I'm close to wrapping up. Close to wrapping up. So, sometimes, we all need support. Believe me, one of the things I do as a parent coach, as a parent and teen coach, is people. There's a lot of things that people want to achieve in their lives. They want to do. For example, as a parent, I know that you probably have an idea of how you'd want your family to be, or maybe you don't. One of the exercises I take parents through is to create a family mission. What's your mission and vision for your family? And a lot of parents don't have that. Now, I know that organizations have missions, mission statements, and vision statements. Businesses do as well. As an individual, you actually need to have your own personal mission and vision statement. And as a family or as a parent, you need to have your own mission and vision and mission for parenting. Because if you don't, then there's nothing to gauge whether you are on track or you're going off. What a vision and mission does to you is that it gives you a blueprint of how to walk, of where you're going, so that you're constantly gauging and assessing yourself to see, am I walking in line? Am I in the same direction towards where I want to go, or am I going away from it? Okay. So now, truth is that all of us need support, and that's very okay. It's very okay to seek for help. I want you to know that it's very, very okay for us to seek for help. So if you notice that your child, consistently just withdraws, or is anxious, it might just be a signal for you. It might just be a pointer for you that they may need a counselor, or they may need a coach in their life, to somebody to talk with. Okay, it may just be a sign. So it's very crucial for you. Again, how you can know this is when you interact with them, when you build that relationship, when you spend time with them. Spending time with your child and giving them the whole of your attention is very, very crucial, because it's at those moments where you converse with them, you get to know them, that you would begin to notice some of those issues that are going on in their lives that you need to deal with, that you probably need to seek help um, immediately for. Now, one of the things that I usually tell parents is, truth is that you cannot love what you don't know, right? You cannot love what you don't know. And when I'm saying this usually in connection to knowing your child. One of the best things you can do, okay, is to get to spend time with your child. Believe me, spending time with your child would get you. That's the way you build the connection. The more time you see that, look at the friends that you have in your life as parents, as a parent. There are people that you spend time with. There are people that you communicate with frequently. It's the same thing when it comes to our children. Not just being in the same house does not grow your connection. It doesn't build your relationship. Yes, it may provide the platform for that to happen, but if you do not take extra and intentional steps, that will not happen. So you want to make sure that you spend time talking with your child, spend time just being with them. Again, like I said, it doesn't have to be a long time. So by spending time with your children, you find out whether you need to seek for professional help outside, seeing a counselor or a therapist or a coach. The only way that you get to see that or to know that is when you spend time with that. And again, that's where I come in as well. I work with families in different situations, and it's amazing how I see that the small shifts, I see small shifts happening in their perspective, small changes in their perspective, and I'm seeing how the small habits that they're changing are helping to transform their relationship with their children. Believe me, I had a workshop last week, Saturday. Tomorrow is going to be 1 week. Something we talked about. I spent 3 hours with these parents, but by Monday, I was already hearing testimonies because these were things that were intentional. These were things that were specific. And I mentioned some of them. Take time to first of all assess your own parenting, or first of all assess how you were brought up, and pick out those negative habits, those negative traits that you see, those negative things that you experienced while you were growing up, and make it intentional to break that cycle. First of all, understand that your child has emotions and begin to choose to spend time with them. Again, get to know them, spend time with them. But another thing that you can do is to get them to know you. You can tell your child about what things were like for you when you were their age. What was life like for you? What were some of the things that gave you that made you to have fun? Right? What were some of the things that made you sad? What were some of the things that you really love to? What is one thing that you love to do every day? How did your parents treat you? Who was your best friend? So you're inviting your children also into your world. You spend time getting into their world, getting to know them, but you're also spending time inviting them into your world. Many times our children rather don't see us beyond mommy and daddy. That's all they know. They know that daddy provides for me, takes me to school, takes me to see my friends, provides food for us in the house, and when I need clothes, I have clothes, they provide for me, and that is all they know. But do your children know do when you drop them off at school and go to work? What is work like for you? Invite them to understand what mommy and daddy do. See, they need to understand that daddy and mommy are beyond just parents. They also have other things that they do. What are your fears? What are your hopes? What are your dreams? Share them with your children. Today, I'm going to get a lot of feedback from the parents I'm working with about how they invited their children into their world. And believe me, it's one of the powerful ways, again, that you can connect with your child. Let them know this is what daddy feels. Daddy also feels scared sometimes. Mommy also feels afraid sometimes. Mommy gets angry. But this is what I'm hoping for in the future. This is something that mommy wants to do if she gets a chance to do it. Let them know that you also have things that you are passionate about, things that interest you. Again, as you share your own with them, remember that you are modeling for them. When you speak to them, and you ask for them to share, they would also share, because you are modeling that it's okay to share what we feel. It's okay to share about our needs, and share things that are going on in our lives. Okay. So again, I said it's important for us to just know that you it's okay to find help. Okay, it's okay to find help when you are going through tough times. You're going through tough times. All right. So before we wrap up, let me leave you with this. Parenting a child with sickle cell is, again, it's not about being perfect. It's not about perfection. Nobody is perfect. We have our own flaws. We have our own weaknesses. We have our own struggles. So if you see yourself failing, please don't beat yourself up about it. But we can rise up, seek for help, and continue moving. It's not about being perfect. It's about you being present in the, letting your child know that beyond any shadow of a doubt, that's the place where you want to get your child to understand that whatever happens, I want you to know that I am here for you. I am going to be present in your life. Okay, you need to let them know that. So the love and effort in that you is going to matter, should matter more than anything. Unconditional love, no judgment. How they feel, you're not judging them, but you're only trying to understand, but you are seeing it through their perspective. I remember, again, you are not alone in this. If you need support, please reach out. I know that Auntie Kemi is doing so much to help you parents, so that you're able to parent your children much more intentionally, and that's very good. So, but if you need some one-on-one support, you can reach out. There are professionals who can help you. If there's a support group that you can even join, or a trusted friend, or you want to find somebody that's a professional, please go ahead and do that. Reach out, and so that you don't go through this alone. Okay. So thank you so much for your time. Thank you so much for listening, and for also being here today to find the tips and strategies that can help you to be able to connect with your child. Again, I only just scratched the surface today. There's a lot more to talk about when we're talking about building deeper connections with your children. But thank you again for taking out the time today. I think we might want to take questions. Auntie Kemi, go ahead. Thank you so much.
Thank you so much, sir. Thank you so much. This is a wonderful session. And this is a session that a lot of parents don't pay attention to. A lot of us parents, we don't pay attention to this. Yes, this is a very great session. A lot of us parents don't pay attention to this. And the reason is that we we actually believe that emotional connection is not okay, it's not good. But there's not how if you don't have emotional connection with your child, there are some things that will be difficult for you, especially when it's a child that has sickle cell. You will not be able to empathize with them. You will not be able to understand exactly why they are acting some ways. You will not be able to even allow them to even use their medication the right way. So some of those things that we say, oh, they don't listen, they are too stubborn, it's because we are not connecting with them emotionally. So, and then thank you so much, coach. We are ready to take your question in the next 2 minutes, because our next guest is here. Next 2 minutes, please, if you have question, drop your question in the comment section, please, so that coach can actually attend to it. Our next guest is here. Okay, let's put this. Sorry. We have a question, sir. Please, how can I handle my girl that prefer keeping things to herself?
Oh, okay. Yes, yes, I see this. Thank you. That's such a great question. Um, a lot of times when children keep to themselves, in fact, even adults, as adults, we keep things to ourselves for a couple of reasons. Number one, we are afraid of judgment. Okay, we're afraid of being judged. We are also afraid of being criticized as well, or even we're afraid of not being understood. So first of all, you need to understand that that these might be the reasons why your, I don't know how old she is, but why your girl is keeping things to herself. Maybe there's fear of she's afraid of judgment from you or from other people. But if it's with you, you're talking about, she's probably afraid that you would judge, of judgment, of you criticizing, or maybe of you not even understanding her. So it's possible that it could be that all of these came from you or from other people, and so she's projecting what she has experienced from other people and applying it to you. Okay, so what you want to do, number one, first of all, is that you need to when something happens, when she shares something with you, you don't want to overreact. Okay, if it's something that you're very surprised about, or maybe that is concerning, if you overreact, what happens is that, okay, should begin to understand that, okay, if I share things like this with mommy, then she's going to blow things out of proportion. So you want to first of all avoid overreacting, as you engage her in conversations. Yeah, so basically just that. And then secondly, you want to be calm. You want to let her know, use supportive language. Let her know that, say something like, I'm glad that you told me this. Thank you for trusting me with this. Okay, and make sure that the tone of your voice and your body language actually show also that you're approachable. One of the things that we don't that we miss sometimes is that when our children are talking to us, you cross your arms, you're frowning, and I say, what is it now? Those kinds of things can actually put a barrier, and your child will not be able to reach out to you and share things that are very sensitive with them. So also one of the things is that it's possible that when they're sharing, you're not fully present with them. Okay, your child needs to know that if they're sharing something that is important to them, they need to know that you're present, you're actually available to listen to them without any interruptions. So if there's a distraction, you keep it aside when your child is talking to you. Okay. So again, one-on-one, you want to spend one-on-one time with them, just like we talked about. It doesn't have to be for many hours in a day. Just a few minutes can do it, and then they begin to naturally open up to you. Okay. Also, you can ask open-ended questions. For example, Sarah, what's the best part of your day today? What happened? How do you feel about what happened in school? You're asking her questions that would help her to actually open up. And while she's doing that, you are very much attentive. Again, you're not overreacting, you're not judging. Let's assume that she said, oh, she slapped somebody. You cannot just overreact. You want to remain calm. Okay, you need to be a calm parent. Is there something you want to talk with me about? Okay, again, show empathy. We talked about empathy already, so you can reflect the feelings and let her know that's okay to be upset. For example, if she was upset about something, so just show empathy and remember that feelings are okay as well. So yeah, respect her boundaries, and then also just provide room for open communication even as you move forward. Okay, so I hope that this can help you. All right. Is there another question? Okay, she's 14 years old. That's beautiful. That's beautiful. All right. Any other questions?
Multi hardest you can tell enough 15. Okay, I don't think we have another question again. So thank you so much, Coach. Thank you so much. And this is a very wonderful session. And I'm glad that a lot of our parents has a lot of things to say about this session. Thank you
Hmm.
so much. Please, if you are here and then you know that this session touched you, can you drop a message to let Coach know how well this message has helped you? Thank you so much. So we have our next speaker.
Thank you for the opportunity. I appreciate you.
You are welcome, sir. We have our
Yeah.
next speaker already. Yes. Thank you so much, sir. I really appreciate. Well done, sir. Thank you so much, sir. So we really appreciate you. Thank you so much, sir. Mm. So now we have farm doing will be talking to us about insurance because we all understand what it means. We all understand exactly what it means to raise a child with sickle cell. But this is somebody from the inside that can actually tell us the best plan for our child that lives with sickle cell. How when we tell, oh, LHI, they have not been supportive, they have not been this. Somebody is here to now give us the right answer. So let me bring in Famdoni. Famdoni, welcome. I think sorry, we are so sorry for the delay. We are very, very sorry for the delay.
Good evening, everyone. Can you hear me?
Ooh. The floor is yours now, sir.
I'm really sorry for the dark this place. I'm the only one left in the office. I never knew these people would take off the light. I'm really sorry. But I hope you can hear me clearly.
Yes, we can see you. We can see you. We can see you.
We're going to improvise, but I hope my voice is clear enough.
Yes, your voice is loud and clear. Please, you can hear him. Let him say loud and clear. Loud and clear.
Okay. Good evening, everyone. It's good to be here. I'll, I'll be presenting on the topic combating health emergencies and reducing financial burden in sickle cell management. I'll be dwelling more on the financial risk burden and the catastrophic expenditure aspect of sickle cell disease patient in both in the patient and in the caregiver. In 2006, WHO identified sickle cell diseases as a global public health crisis. And in Africa, basically, it's been recorded that there are about 230,000 children are born with sickle cell each year. And among this huge number, Nigeria is the highest burden of sickle cell presently in the world. And not just that we are just the burden, the data indices is not really looking good at all as far as Nigerian income is concerned. We have a sickle cell is prevalence about 2 to 3%. We have about 150,000 new birth per year, and the infant mortality is at 8%, and under five mortality is at 8%. The major problem we have basically is with the 150,000 bet. Out of the 150,000 bet, records have shown it that about 70 to 90% of them do not live up to 5 years, which simply means between 70 to 80% of them died before age 5. What is really responsible for this? It's been documented that a lot of these babies died as a result of complication from sickle cell diseases. And we all know what the complication of sickle cell diseases is, from leg ulcer, anemia, osteoporosis, and the rest of them. But why are people dying because of this complication? There are several reasons why people died as a result of this complication. And one of the major factors is the financial burden on it. There's something we call in health insurance as out-of-pocket expenditure. What out-of-pocket expenditure basically means is each time you have an health crisis, or there's a need for you to visit an health care, or you need to purchase medications, you are going to buy those medications directly from your purse. And Nigeria being an economy that is unstable currently, Nigeria is currently experiencing what we mean by galloping inflation. If you can ask yourself, how much did you buy a pack of hydroxyurea in January? How much did you buy it in June? How much was it last year? And how much is it now? When you look at all these things, then you look at the differences in price, and the household income is constant. Even the new minimum wage has not really been that has been implemented. Not everybody in Nigeria is getting it. So what if the household income is constant and the cost of your Medicare is increasing as at the rate of the inflation in the country? The entire household is going to run into crisis, which we call most often than not as catastrophic expenditure. Out of pocket expenditure has been one of the major leading causes of catastrophic expenditure in Nigeria. And from available data, when you compare Nigeria and some other developed nations, when you compare the incident of sickle cell anemia in Nigeria and you consider it out, and you check the life expectancy ratio between the two different countries, the difference is extremely clear. In Nigeria, the life expectancy ratio is about 21, while in in the, while in the Western world is about 51%. So what is really responsible for this is as a result of this. So I'll be dwelling much on health insurance. So what we are simply going to do basically is due to the chronic nature of sickle cell diseases, you are going to be visiting the hospital frequently. And just say for example, if in a quarter, if there's need for you to access health care in any health facilities in Nigeria in a quarter, you know how much you are going to pay. Take for example, if the total income of an household, let's put it at 200,000 naira, and there is need for you to visit an hospital every month. You know how much you spend out of that. So you are going to forego some other important things that the baby might actually need. And one of the major causes of this is because of the instability, the unstable prices of drug commodities, the unstable prices of drug Medicare, because almost virtually everything we do is dollar denominated. So just like what WHO defined recently, universal health coverage. Universal health coverage simply means everyone having access to quality health care when and where they need it, and at no risk, at no financial risk to them. If we are asking ourselves that at no financial risk to them, how are you going to go about it? So it's better you go through what we call prepayment mechanism. Prepayment mechanism tends to protect the caregiver and the sickle cell diseases patient from the financial risk of out-of-pocket expenditure. What we simply mean by prepayment mechanism is, take for example, if you purchase an health insurance plan in January this year, and let's say whether the premium you are paying is 30,000 naira. You know, once you pay the 30,000 errors in January, you are assured for you are insured for your life is insured for the entire year. So irrespective of the rate of inflation in the country, each time you have medical emergencies, you go to the hospitals, you are not going to pay for any health care. That premium is going to cover you for the entire duration of that 1 year, so that the household will still have enough money to be able to pay school fees, tackle malnutrition, and every other attendant effect that might be result. So we at NHIS, what they have done basically for sickle cell diseases patients is a multi-sectoral approach. And what we mean by multi-sectoral approach basically is you look at the entire family, you look at their vulnerability. And what we mean by vulnerability now, that you look at it, okay, why is the patient vulnerable? I don't know whether you can hear me, please. So you look at it, why is the patient vulnerable? Just like in 2022, when the new National Health Act was signed, there's a section of the new National Health Act that made it compulsory for federal government to set aside nothing less than 1% of the consolidated, nothing less than 1% of their consolidated earning. And this money was set aside to pay for health care needs of the people. That was what brought about basic health care provision fund. So what we are doing basically is for sickle cell diseases patients that falls within the category of people, category of people that are vulnerable, based on that program, they are insured, and this money is being paid by federal government, and it is being driven by the
Hello, sir. Hello, sir. Can you hear us? We can't hear you. Please, can you hear him? If you can hear him, let me say in the comment section. Can we? Sorry.
I'm listening to the phone.
Um,
And the person thinks you should come.
Send message. Okay.
Section tomorrow.
I don't know. I think something is wrong with his network. So we'll be having this session tomorrow again. We'll have this session early before we go into the business of the day. So as early as 4 o'clock, we'll be having this session again. So we are bringing in the last person for today, and then all of us can go and rest. So fam, will be having you again tomorrow. So I'm bringing in.
I told him to get married.
I'm bringing in Miss Olowo Olaoluwa Kinton. Yes, Olaluwa Numa from the Azamaza. This is an HMOs that I've been using. They are private HMOs that I personally have used. And then at some point in time, some of our sickle cell warriors were placed on it. And it's actually very great for us. So this is the reason why we are inviting her to talk to us about financial strain. There's a way, if you keep paying for hospital bills out of pocket, you will end up broke. Let us be sincere with ourselves, because sickle cell can come up with in any form. Before you know it, today you end up going to the hospital. You just want to go and see your doctor for checkup. Only for your doctor to tell you, you will be running this test, you'll be running this test. By the time they calculate all those tests, it's already a lot of money. And after that, then they will tell you, oh, you need to be on admission because the results we are seeing, we cannot allow you to go back home. That is unplanned money. That is unplanned money. And this is why we have Miss Miss Olaluwakinto here. Please welcome. We welcome you, sir. Welcome her as she joined us.
Okay. Good evening, everybody. Thank you so much, Kemi, for the introduction. Good evening.
You are welcome.
Okay, may
I think I need to
Okay.
make you have the full screen.
Okay. So I just want to just do a brief introduction on what we do. My name is Kiton, like she mentioned. So I know the topic itself is generally parenting a sickle cell child with purpose, but my own session is the financial and medical lifeline, how you can leverage healthcare insurance for sickle cell care, and how HMO itself helps manage these emergencies. So I just want to try to make it a bit quick, not to take our time, and just speak on the primary purpose of HMO plans. So HMO plans have two major purposes. The first is to provide access to quality healthcare services, like we all know. So HMO offers a network of healthcare providers, including doctors, hospitals, and specialists. And why this is peculiar to sickle cell itself is because it provides access to specialized care. So why I use the word specialized is because you know that it's not just somebody going to say, oh, I have a headache and I need to see a doctor. I'm not really sure what this is for. But specialized care includes things like seeing a hematologist and other specialists who can manage the sickle cell disease. The second primary purpose of HMO is to reduce out-of-pocket medical expenses. So why this is important, because I know I'm speaking to the financial and medical lifeline, leveraging healthcare. And we know that the cost of healthcare is pretty expensive, but HMO is more comprehensive to help people manage their finances and treat these conditions better. So HMO plans cover a significant portion of medical costs. So if you've been to hospital, I don't know if you ever hear when a doctor or the receptionist will say private or HMO. This already explains that you have an option for a payment, or they give you an option and they have different benefits and different services. So the HMO plans cover a significant portion of medical costs, and the purpose of the HMO is to reduce the financial burden on individuals and families. And it's so important because you know that when it comes to parenting a child who is managing sickle cell, it can be very expensive financially, emotionally, and HMO itself is we're concerned with the health and overall well-being of the parents and the child who is managing this condition. So I'm just going to go speak a bit. I'm not going to speak too much about what HMO covers, like, oh, you have access to hospitals, or this is how much it costs. I want to speak more about the benefits of HMO plans for sickle cell care. So the first benefit I would say, like I mentioned, the primary purpose of HMO plans and how they can help sickle cell care is that it mostly offers financial relief, because we can all agree that the cost of medical care is very expensive. And it also reduces medical costs. So financial relief meaning that you're not bearing all the costs by yourself. The HMO plan is packaged or is is tailored in a way that actually meets your basic healthcare needs. While we can't predict what healthcare conditions you go to hospital for, but because we have these specialists like a hematologist or other specialists who are trained to treat these certain things, we know that leveraging healthcare or health insurance for sickle cell care is very important. So I'm just going to speak to, I think I've spoken about the coverage for routine medical care. So if you know that, okay, if a parent knows that, okay, my child is managing sickle cell, there needs to be a routine medical checkup. So maybe the doctor says, oh, every week or every 2 weeks, this is what kind of medications your child might need, or these are the things that might come up. So this having a HMO plan is very comprehensive, and it covers routine medical care like doctor visits, laboratory tests, and prescription medications. That's the first benefit. It's always be going through 10 benefits. So the second benefit, like I mentioned, would be access to specialized care, because there is a condition that needs to be treated and managed. So the HMO actually help give you like a plan or a routine for the care the child needs. Another thing that's very important is emergency care coverage. So I know that a lot of people who might be managing sickle cell they might be aware that there might be instances where this person that's managing this condition might have emergency. So this is something that's considered. And so we cover things like emergency care, hospitalization, urgent care visits, which are critical for managing sickle cell emergencies. I also mentioned the reduced out-of-pocket expenses. Or when I say out-of-pocket expenses, this is pretty much when you go to hospital and, like I mentioned earlier, and they say private or HMO. If it's private, they might ask you, oh, you have to pay for registration, you need to pay for consultation, you may need to pay for the medication. So these are what HMO actually offers. So you don't have to pay for these things. Your HMO would naturally just get your do a medical questionnaire, get your details, and get detailed information about each individual, right? So it helps you reduce out of care expenses. A hospital can say, oh, you may need to see a specialist, and this is what the specialist charges. Are you going to proceed? Or you might need to buy these other medications. All these things, all these costs that are incurred are reduced when you're on a HMO plan, because these are things that we've seen that, okay, these are things that should be included in this, like the benefits that should be included in these plans. Another thing is preventive care coverage. So in any health condition, preventive care is so important, because this means that you already put in place things like preventive care services like vaccinations, screenings, and health education, which can help prevent sickle cell related complications. So one thing that HMO does, I know I'm speaking from AXA Master's point of view, is that we offer health talks. This is something that I feel in Nigeria we don't do as often as we should. A lot of NGOs do it, a lot of HMOs like AXA Master does it. We do medical outreaches, but I feel like a lot of people are not yet informed as we think people are informed. Yes, I know people know what SS is, because people know that this person is SS. They have a mindset of it, but there are so many misconceptions and myths about sickle cell that people don't know, right? I just believe that this is one of the benefits HMO offers. Like we do health talks, screenings, and health educations for. So, for instance, if you're an NGO or an organization or a company, and you're saying, okay, you would like to have a health talk on how people can better manage sickle cell, or for children with it, or parents, or families, or an organization that has these people. These are things that will help people manage this health condition better. I'm on the sixth benefit now. So sixth benefit is chronic disease management. So we have specialists, like I mentioned, specialists who are trained and licensed professionals who can manage these if there's any complications. So we have specialists who manage these chronic conditions better. So another thing that I know that we don't speak about is the counseling and therapy support that even the child as well as the parents might actually need. So dealing with anything like sickle cell, because sickle cell is a blood disorder that's typically inherited because of the gene AS and AS, right? So it results in, an abnormality in the sorry, in the oxygen carrying protein called hemoglobin found in red blood cells. So we know that sometimes the parents might be overwhelmed, or the child might not know how to cope with some things. And we know that therapy or counseling is not something that people speak to a lot, but AXA Mansard's HMO offers counseling and therapy support, because coping with the emotional and psychological aspects of this condition is not something that is the same for everybody. Different people have different coping mechanisms, and we know that it's not easy for people to speak about some things sometimes. And so we have a counseling benefits even on a normal HMO plan. For a corporate HMO, this is something that we feel that this is a benefit that people should always have, because even besides even sickle cell, there's so many things that people are going through on a daily basis that they just need somebody else to speak to. Oh, they just need somebody to hear them out. Oh, I've been having a really bad day. I'm so stressed from work. I'm so stressed from what the country is doing. So there's so many stressors that we are all exposed to every day. It could be working long hours, um, spending a 9 to 5. Maybe your 9 to 5 at work is turning to 9 to 9. It could be spending your hours in traffic. There's so many things happening at the same time. So we know that counseling and therapy is such an important benefit of HMO. Another benefit because of the condition is pharmacy benefits. So parents and children with managing this condition have access to affordable and convenient over-the-counter medications. So somebody managing sickle cell will know that, okay, these are the medications I will need during this particular period. Every 2 weeks, I need a refill. So we make it easier for people to buy their medications. So you can either request for it. Let's say your hospital gives you a sheet that says, okay, this is the medications you might need. So you then present to the HMO provider, and then we help you order it. You can either pick it up from the nearest pharmacy, or we deliver it to your office or home. It's convenient. So the pickup and delivery of prescription medications is something we know that this is also beneficial for the parents and the children or the child. So there's something called case management services. So we try to help people that manage any condition. I'm speaking about sickle cell now. Help them navigate the healthcare system and access necessary services. But the most important one, which would be the last benefit, would be the financial protection. Like I mentioned, we know how expensive and we know how costly it is to manage healthcare. But having a HMO plan provides financial protection against unexpected medical bills. So you might go to hospital and you might have an idea of, okay, I shouldn't spend more than, let's say, 30,000. And you get there and say, okay, the cost of things have gone up, inflation has affected our costs, the cost of running the hospital, or they might be using a generator, and other factors that a hospital can even tell you, right? So HMO helps you avoid these unexpected medical bills. So maybe there's a treatment and they say, okay, this treatment, you must pay extra money out of pocket. And these are really expensive, things that happen on a daily basis in hospitals. And this is one of the benefits why HMO is a better option than paying out of pocket. So it just really helps people reduce the financial stress and anxiety that individuals may experience with sickle cell conditions and their families. I also wanted to just speak on, so pretty much a summary of what I've spoken on is insights into how HMO, so this is how HMO can support families during emergencies and routine sickle cell care. We've spoken about the financial relief health insurance offers, reducing the burden of medical costs associated with these chronic conditions. So AXA Mansard has specific offerings for individuals living with sickle cell and their families. So if an individual was to buy a sickle cell plan a HMO plan, for instance, for somebody who was managing sickle cell, we would have to buy it under a corporate HMO plan, and I'll explain why. So AXA Mansard has 3 types of plans. You have a retail plan, you have an SME plan, and a corporate plan. So retail plan meaning that
Ọlọ́run bàbá ẹ jẹ́ ká fi ojú tì ó jọ.
I'm just going to try my waste my sorry.
Moreover, we have outstanding payment
Okay, so the retail plan, I thought you came out to say something on. Okay, so the retail plan is for individuals and families, while the corporate plan is for a company or an organization or an association. So we believe that there are so many practical steps for parents that parents need to access and maximize the benefits of health insurance plans. So I know that a lot of people are not informed about the benefits or what they need to do of managing or empowering. So most times people, parents who have children that are managing the sickle cell condition, they might need caregivers or people who are trained in managing children with sickle cell. So we always try and make sure it's important that they're equipped with the right information, they have access to quality healthcare services to better manage their children's health and overall well-being. Thank you. Does anybody have any questions?
Big question. If you have any question, let us drop it. We are about to
Okay.
round up now. If you have any question concerning this,
If you have any question, let us drop it. We are about to round up now. If you have any question concerning. Okay, I saw some people said that they don't give up medications and stress. Okay, I'm not seeing any questions on there yet. Okay, there's none. Kemi, you can carry on. Let me just.
okay. Question. Okay. So if you want to register for your plan, how much is the one that is suitable for people living with sickle cell? What's the plan? What's the
Okay.
name?
Okay. So let me just speak to something. So in Axamansat, we have a plan called retail, which is for individuals and families, and we have a corporate plan. So under our retail plan, we don't cover retail is for individuals and families. So we usually don't cover pre-existing conditions, something like sickle cell, because it's something that needs to be managed and it's really expensive. So in the first year, the HMO does not cover the cost of care, which is not even beneficial. So we will then always recommend a corporate plan. So usually we have people who are in maybe an association or an organization who bring a group of people together and say, okay, this group of people are managing this condition, or a foundation who wants to register. So this is a corporate plan. So the cost for the corporate plan per person, we have a bronze, so we have different plans. It's called bronze, silver, gold. And the least plan is about 79,000 for a whole year. So the thing about HMO is we usually work based on the number of people. So the corporate plan, the minimum number of people is 20 people, right? So we start from 20 people upwards. So this can be the family of maybe a family of two. So I know the topic is parenting a sickle cell child, so I want to speak to something. If it's a child that has that is managing this skincare, the health concern, sickle cell, we don't enter contracts with minors. So I know you asked for the price. I'm trying to explain it a bit further so you can understand it better. We don't enter contracts with minors. So let's say, for instance, a child has sickle cell. We would have to enroll the parents and so the minimum costs about 79,000. I could share. It's a really long because there's bronze, there's silver, there's gold, there's platinum. These are the cadres that we have. There's bronze, silver, gold, platinum plus, and rhodium. I can share I don't know if I can leave in the chat option. I'm not on YouTube. I see that I can only leave a comment if I connect YouTube to my account. But I can put the pricing. But the minimum starts from about 70,000. It goes up to about 90,000 for the next plan. And the other one costs maybe over 100,000. So the access to care, the pricing is different based on the limit of care. So there are different plans.
Okay.
I could share that in the chat.
Okay. So now, if you want to do it, together, because you know that we don't belong to the same, even though we are under the same maybe basic Sickle parenting conference, we are not from
Okay.
the same state. Is it
Okay.
possible for us to register together under the same like Sickle Cell Parent
Foundation.
Network?
Okay, so what we do is the reason why we don't always it's not always advisable for so in HMO we have something we have called pre-existing condition, and the reason why we let people know that the HMO or the health insurance cannot bear the cost of the pre-existing condition because it's always very expensive. And people will still tend to pay out of pocket, which is why we opt for a corporate plan. So if the foundation wants to buy a plan for, okay, say, okay, this foundation and or a body or a committee or an association, this is when maybe something like the Sickle Cell Foundation can buy a corporate plan because we see it as an entity and it costs less and have more access to care. So a foundation can buy a HMO plan, if an association can buy a corporate HMO plan because we see it as a corporate entity, like a group of people that are over 20. Then if it's an SME, if the number of people falls between 11 to 14. So for HMO, we usually use the number of people and what we call, because I know most people don't know this, but HMO is still insurance. And insurance itself is a contract, right? So it's not something we just say, oh, this is the price, pay, you have access to care immediately. We first need to fill what we call a medical questionnaire to understand. So if it's already, let's just say, for instance, a child managing sickle cell, and one, we don't enter contracts with minors, meaning that we can't just enroll a child for our HMO service without them being registered under a parent or a guardian, right? So, for instance, let's say a child that is 8 years old who is managing sickle cell, and the parent says, oh, I want to pay for a HMO plan for my child. We will tell these parents that, oh, you need to be the one to register for the plan and then put your child under you because we will believe that you are the principal and then you have a dependent who also needs access care. So that is how it works. But we usually have to do the medical questionnaire before we can even ascertain how much it might cost. Because it might need a customized plan based on the health information that they provide us with. But if for the pricing, I could still share a document. I hope that I could have shared that before this call, but it's something I can still share after this session.
Okay, thank you so much. Thank you so much. So a lot of us here, we also have a community group. If possible,
Okay.
if they have questions, we can invite you for you to come and spend maybe some few time and then talk clearly with them. So we may want to have questions, okay, how much can we get and all that. So I think that is
Okay.
something we can actually arrange later. So thank you
Okay.
so much for
Thank you so much for having me.
thank you for coming. Thank you for actually explaining in details. Thank you so much. So if you have any question, I think we don't have questions. So if you still have question, you can drop it. And if you don't have question, we are already coming to the end of this conference. Yeah. So please, in one word, can you actually drop how you feel about this conference today. You just want to tell us in one word what you have learned, the speakers, everything about this conference. What does this conference means to you? So just drop a comment for us and let us see. So thank you so much.
Thank you.
I think I will send you a message later. Thank you so much.
Thank you for.
So, in one word, just drop it. If you can hear me, I'm very sure you can hear me. So, in one word, just summarize everything you have with one word. Just write one word for us and describe how this conference has been. Is it worth it? So I want to say thank you to everybody that actually stayed to the end of this conference. Thank you so much for paying attention. Thank you for using your time. Thank you for coming despite all the things that you planned for. I appreciate you. And tomorrow we go again. Tomorrow is going to be very awesome because we have people who are actually people with lived experience. You know, every time we talk about this, we also bring people with lived experience. When you're talking to somebody that has more, somebody that has lived it, somebody that has experience, and they are now a professional, it's going to be so great. So tomorrow we are expecting a lot of speakers that are very, very deep, and then they will be talking from the perspective of professional and from someone who has a lived experience. So same time, 4 o'clock. We are starting 4 o'clock tomorrow, and I really want to appreciate everybody who every participant of this conference. There is going to be a replay, and then the replay will drop it in the group. Thank you so much. And see you again tomorrow. I still remain Kemi Oguntime. Bye. Mm.